Hey, what's up? My name is Anthony Trufant. I'm the senior pastor at Emmanuel Baptist Church. That is, to those of you who are guests, to those of you who are members, I'm Rev. And I wanted to welcome you to Exiting Egypt 2020. And some of you may wonder where the title, Exiting Egypt, came from. I want you to know that it flowed out of my experience, two separate events that have been merged that form the source of the name for this event. The first source is from when I made my final student loan payment. I owed about $50,000, which I thought was a sizable chunk. I made the final payment and I turned to Muriel and I said to her, I feel like I am a slave whose burden has been lifted. I have exited Egypt and I have no intentions of ever returning. And the second source of inspiration for the name actually came out of a conversation that I had with a colleague of mine, Dr. William Watley, the pastor of the St. Philip's AME Church in Atlanta. He was a presenter at the conference that the annual conference that I host entitled Rethink and Retool, which seeks to empower and inspire pastors to think differently and more creatively about their churches. At any rate, he said in one of his presentations that while we are confronted with the reality of racism and sexism, that he believed the last obstacle to our survival and liberation as a people are not simply racism and sexism, but economic bondage. He suggested that until we're able to address the issue of economic bondage, our indebtedness, that we as a people will never be free. So those two things form the inspiration for the title of this experience. This experience has grown well beyond anything I could have imagined when we started about 7 years ago. I am appreciative of the leadership that Dwayne Jones and Leland have shown as they have pulled together this experience and as they have done so in a creative, condensed format. And so I'm thankful for their leadership and for the participation and the support of the board and of A Better World. And I want you to know that at the end of this experience, the intent is to put in your hands the conceptual and practical tools that you will need in order to, one, get out of debt, two, to make wise use of your resources in terms of investments and stocks and other things, but then finally to build generational wealth. And so I hope that you will be as blessed by this experience as I have been in past years. Let us pray. Oh God, we give you thanks for who you are to each of us and what you've done for all of us. We thank you, God, for your provision, for giving us the resources that we have. And while we may quibble with you about how much we have, and while we may crave more, we pray, oh God, that you would teach us how to be better stewards of what you have entrusted into our care, how to live not simply within our means, but beneath our means, and how to take the blessing that you have given us and use it wisely and well so that we might be a blessing to others, not only in our generation, but in the generations that are to come. Bless each presenter and each participant. May this be a powerful and equipping experience for all. This is our prayer we ask in Jesus' name. Amen.
Good morning. It's a pleasure having you this bright and early Saturday morning, and thank you for joining us for Exiting Egypt, 7th Annual Community Development Conference. Thank you to Reverend Trufant for those introductory words. Thank you to Reverend Trufant and Emmanuel Baptist Church, trustees, deacons, members for the support and the platform to do this work. My name is Dwayne Jones. I'm the chair of the A Better World Community Development Corporation of EBC. This is one of the events that we put on annually, in addition to our Teens That Mean Business program, our development work in South Africa, and business directory. And the idea behind this work is strengthening our community, as the name of our development corporation suggests. When we were thinking about putting on the Community Development Conference, as we have done in years past, we were concerned about the ability to host it in the environment and dealing with the realities that we've all been encountering over the last few months. Social distancing, death, mourning, navigating a new normal. From the practical sense, we knew that it would be extremely difficult to meet in person and just not something in the cards. So here we have a virtual community development conference, and we're happy to have you join us as we tackle some of the issues that have been brought to light. Not just dealing with COVID-19, but in addition to that, dealing with the racial, economic, and social disparities that it's really laid bare. Part of what we wanted to do was provide the tools to allow you to navigate and understand the reality that we're dealing with in terms of the new normal, so to speak. And how do we navigate this new normal and come out and emerge more powerfully so that we can get to the work of building wealth and communities? The way that we've structured the Community Development Conference is 3 distinct panels, and I'd like to take some time to thank the board of A Better World Community Development Corporation, as well as the chair of this committee, Paula Fendel, and the work that has gone into doing this. I'd also like to thank the professionals that have donated their time, energy, expertise, and passion to help us understand where we are and where we're looking to go. Our first panel deals with mental health and wellness in the time of COVID-19. We know very well the microaggressions that come along with racial disparities. We know very well that there has to have been a new way to mourn during this time, not being able to attend funerals, not being able to connect with loved ones. So we need real tools in order to deal with, one, the health issues that have arisen in the last few weeks and months, and that's likely to still be with us and might come back even stronger than it has been. We also need tools in terms of how to protect ourselves mentally from the realities that we deal with related to inequality and how that inequality has been laid bare by COVID-19. So I'm pleased to bring on a great panel, introducing the moderator, Teresa Allen, who has over 35 years of experience in terms of facilitating and providing therapy. And she's the founder and CEO of her own company dealing with these issues. Her bio is in the program. I have personally experienced and benefited from her skill as a facilitator, a presenter, and professional. So I'll bring her on so she can introduce the rest of the panel and turn it over to our mental health and wellness panel.
Thank you, Dwayne. And good morning, family, community, family, EBC members. It is my pleasure to moderate this panel this morning. And as a way of sort of introducing what's been happening, I have borrowed a line from the former Assistant Secretary, I think you lost me, from the former Assistant Secretary of Legislative Affairs that recently resigned. And she said, moments of upheaval can change you, shift the trajectory of your life, and mold your character. And I think we all can agree that these last 3 months have done just that on various levels. And so this morning, we are going to spend about an hour talking about health and mental health issues, how it has impacted us in our communities. And I have 3 esteemed panelists that will speak to that in a little while. The first panelist is Dr. Robert Gore. And Dr. Robert Gore is an ER doctor. He is the founder and executive director of the Kings Against Violence Initiative, CAVI. He is an attending physician and clinical assistant professor at Kings County and Downstate Department of Emergency Medicine Services. Dr. Gore speaks on many boards. He is a TED member. He also is the founder of the Minority Medical Student Emergency Summer Program. Dr. Gore has had many experiences during this COVID time dealing with health issues and racial disparities and how medicine has been dispensed and how people have recovered. And it is my pleasure to introduce him so that he can share with us what it's been like with him. Dr. Gore.
Thanks for having me today. One, I want to thank the entire EBC community for welcoming me this morning. I feel pretty connected to you all already, not just because there are many Morehouse men who attend your church, but I also grew up down the street from EBC on St. James Place. But, the reason I kind of think about, most of the work I do is always focusing on community and not just dealing with the issues within our community, but how do we promote our community and heal the community so that we are at our best. As an emergency physician, most of the things that I see in the clinical space are usually life or death matters, whether it's violent trauma, intentional injury, accidental injury, or dealing with illnesses that we've seen recently. Some of the stuff that we've heard of, some of the stuff that we haven't heard of. But the people that we serve at our respective hospitals look like us. They come from our neighborhoods. They are our mothers, they are our fathers, they are our cousins, they are our friends. And it's a very, it hurts when you see someone that you are directly connected to that is in pain and suffering. So I bring that up because right now we're witnessing our entire planet undergo a transformation or an awakening. Awakening in one sense, realizing that we are not as invulnerable as we once thought we were, as has been the case with COVID-19. But also we have been seeing a widespread showing of what we've always known regarding police brutality within our community. Those who are coming from Black, Brown, and other marginalized communities around the planet. And I think we are understanding, we already know the problem. Now the next phase is what are we going to do about it? Most of the work that I deal with outside of the emergency department focuses on trauma. CAVI itself, the Kings Against Violence Initiative, is a hospital, school, and community-based violence intervention and prevention program providing support for young people and their families who have been dealing with trauma. But we're really trying to reframe this entire conversation we have about what is trauma. Trauma itself is often something that we assume is only a physical process, but many of us know and many of us have experienced that trauma goes beyond just a physical process, which is the result of some sort of direct injury. It is a mental process. We know that trauma can be passed down from generation to generation. we may have relatives in our own immediate circles who've been dealing with long-term, deep-seated trauma. And when we sometimes question why are some people caught up in these cycles where they aren't functional or they're not at their best, and they're bright individuals and they're very promising individuals, but sometimes when things keep happening in a pattern that's not most optimal, we have to start looking at what was the cause of all of that, and instead of just blaming a specific circumstance, but looking at long-term causality. And I bring up the whole concept about trauma, not just because this is the work that I deal with, but we saw very interesting parallels with victims and survivors of COVID-19 and victims of police brutality, and victims and survivors of interpersonal violence. When news reports came out in March and early April about COVID-19 patients dying at alarming rates within the African American community and with the Latinx community, some people were questioning and saying, well, wow, I didn't even realize that was the case, and seemed somewhat surprised. But many medical professionals, and myself included, just kind of shrugged our shoulders and said, you know what, this is something that we've always known. Anytime you have a community who doesn't have the resources that are required to be at their best, and we've been surviving for a long period of time, but whenever that community doesn't have what it takes to be in their, existing in their most optimal the optimal set of circumstances, we have to start figuring out what are those issues that are contributing to these overall problems that we're experiencing, and just kind of looking at what's been happening with the protests, and actually even the spark of the protests, which wasn't just the assassination of George Floyd. It wasn't just the assassination of Breonna Taylor, but you have people, our people, us, who were tired of being treated as second-class citizens for a country that we were born in a country that our ancestors built. And so I think the George Floyd's death and Breonna Taylor's death was the culmination of inadequacies and inequities that have existed within this country far too long. And so when I talked about being at your best, there are a number of things that are required for us to have our most optimal communities. And I always use the word optimal instead of just saying community, because there are a lot of communities that exist, but communities that are at a state where they are completely thriving. In order for that to happen, we have to optimize. And so I like to start thinking about what things look like in a best case scenario. In order for our communities to thrive, we need to make sure that there's adequate food, clothing, and shelter, which are the things that are, some of these inalienable rights: life, liberty, and the pursuit of happiness. But we look at our communities as these functional ecosystems. And in the health space, we speak about social determinants of health. Those are our social support systems. And I'm sure Dr. Green-Ford is going to comment on this stuff a little bit more in depth. But having access to quality food, which has a direct impact on our health and well-being. Having access to quality healthcare is essential. Education itself. So it's not just, economic development is probably, is also just as important. If we have one of those things that's completely out of whack, it compromises this entire ecosystem, which we refer to and call our community. And so in order for us to really move forward with ensuring that deaths due to COVID-19 are not at what we've been seeing in the past, making sure that deaths due to intentional violence or HIV or hypertension or heart disease, we have to have all these different systems that are receiving really equal support, or equitable support is probably a better word. But there has to be a level of balance. We have seen, any death that happens beyond, someone surrounded by their family and loved ones at the ripe old age of 90 plus, is an unwarranted death and an unnecessary death. I know we know people within our respective communities who died much younger, but we aren't used to functioning and being in our most optimal states. And so, in order for us to really achieve the type of balance and the type of health and well-being, whether it's due to new cases tied to COVID-19 spread, whether it's due to police brutality, we have to ensure that there are elements of our community which are strengthened, and those are those same pillars of those same determinants which need to be strengthened. And I think, Ms. Allen, I
Thank you.
don't want to keep going about. I know we want to make sure we have time for some questions.
Yes,
too.
we're going to come back around and do that. Thank you so much, Dr. Rob.
Thank you.
And as you mentioned, our second panelist is going to really delve a little bit deeper into the mental health aspect. My second panelist is Dr. Claire Green Ford. And Dr. Claire Green Ford is actually a licensed clinical social worker who is the executive director for the National Association of Social Workers. Dr. Ford's work focuses on the intersectionality of behavioral health, clinical justice, social disparities, trauma, and human development. Dr. Claire, I'd like you to pick it up and go with it. Thank you.
Good morning, and thank you so much. I really appreciate being here. And again, I do want to also say thank you to the EBC family. I have been to your church a few times, and I absolutely love it. And so I'm really grateful to be here and honored to also be on this panel with amazing minds. So Dr. Rob kicked it off for me in terms of talking about social determinants of health. And so I want to be able to frame this conversation in that, and then be able to talk about stress and what we're seeing in our communities, both because of COVID-19 and because of the pandemic of racism that has been happening in this country for over 400 years. And to be able to talk to you a little bit about what that's doing, particularly to the Black community, and how it's impacting our well-being, and some of the things that we can do to address it. So as Dr. Rob mentioned, social determinants of health areas include where we live, where we work, where we eat, what we eat, our education system, our healthcare system. And these are the different systems that really determine our overall health and well-being. And the reality is COVID did not present anything new. The same communities and same zip codes that have been overwhelmingly burdened by COVID deaths and COVID disease are the same communities that for years and years and years, and the same zip codes for years and years and years, that have also had very high prevalence of disease and mental health needs, inadequate access to healthcare, all of those things. And so, yes, we're saying that COVID is laid bare, but it hasn't laid bare for many people who've already been sounding the alarm about these issues for many, many years, and unfortunately not really being heard. And it's taken this pandemic for us to really look at it. So I'm going to talk a little bit about stress, because we talk a lot about stress in our communities, and this is the word, but I want to be clear that stress is the normal pathway and the way that our brains and bodies respond to any demand. You're running, your body's going to be under some stress if you're running, and running is a great activity, but your body's under a little bit of stress because of running, moving, getting married, having a child. All those life occurrences are part of stress. But the problem or the concern that we're seeing right now is traumatic stress. And the reality is that Black communities, Latinx communities, communities of color have disproportionately been under traumatic stress for a very long time. And we know that stress is not healthy in long-term stress, particularly traumatic stress. And when we talk about traumatic stress, we're talking about ongoing stress that is extremely distressing for long periods of time and has significant impact on the overall well-being physically and mentally and socially of individuals, families, and communities. Traumatic stressful events include the pandemic that we're currently in, the loss of normal routine, the loss of social interactions, the ability to go to the hair salon, go to, your bank, go to church physically. All of those things that become part of your social network of support are the things that we know have been impacted by the pandemic. And then when we add in the fact that we know that many people have passed away, our loved ones have passed away, our friends, our colleagues, all of those compounded by us not being able to access our typical means of support, again, the church, your friends and family, colleagues, places that you would typically go, that has really added to it. I want to also add in the fact that racism, an experience of racism is extremely traumatic and extremely stressful. And there's lots of research to connect the correlation between experience of racism and the experience of adverse health outcomes. Mental health needs are directly correlated, particularly anxiety and depression, and I'll define those a little bit later. But I want to be clear is that we need to be more mindful of stress, particularly our overall well-being in the Black community, because we so often don't think that we need to address our mental health need. We don't access services as much. We may not feel comfortable going into services. And that honestly has a lot to do with the fact that the healthcare system in this country has been built on bias and structural violence against people of color. And so it makes sense why we don't engage. Tuskegee experiments were real, and people don't feel comfortable going into these systems for help. So there are other things that we do need to be able to make sure that we do to find ways that we can still access and acknowledge our own humanity. And it starts with us acknowledging that we're not okay. Stress is normal, but this situation that we're in is not normal at all. There's nothing normal about what we're going through right now and what we have been going through for a long period of time. Why is it so important to address stress and our own mental health and well-being? Dr. Rob, as an ER physician, can certainly tell you that the trauma that he sees and the work that he's done, he's going to see that predominantly people of color have higher incidences of high blood pressure, diabetes, some of those same things, which we see links to stress. So we know that stress has a direct impact on cardiovascular health. It has a direct impact on mental health, has a direct impact on gut health, because when you're anxious, when you're stressed, some of us feel it in our stomachs and our guts, that knotting, that twining. And so we know that as well. So our mental health impacts so much of who we are. I always tell people, we can't turn off our brains. Your brain is your computer. It controls everything in your body. And if your brain and your mind are not well, it's not possible for your physical body to be well. And so this is why it's really important that we not only acknowledge what's happening for us mentally and emotionally within our families and our children, but also that we seek to engage supports, no matter what that is, whether it's your church community, your mosque, temple, whatever those things are. If you believe in a higher source, tapping into that, tapping into professionals who are trained and credentialed to provide support. Those are the things that we need to be able to do to help mitigate it. But I wanted to make sure that I drew the parallel between the impact of our mental well-being and our physical state, and particularly in Black and Brown communities where we already know that we're at a disadvantage for having things like higher blood pressure. And that is something that significantly impacts our health as well as our mortality. And that is something that we're seeing happening with COVID. Many people that had COVID, particularly those people that have diabetes, were more susceptible. Diabetes is something that runs in our communities a lot. And there are genetic things that are passed down. So stress is something that is passed down genetically. We see that there are changes on the genetic level with your DNA from maternal stress and anxiety passed on to children. So there's a direct correlation as well. If we're not able to address our overall stress and well-being, we're also seeing that that's changing on a DNA level, who we are and how we respond as we grow. And that's also something that I think it's really important that we note, particularly because we see based on research that in our community, particularly Black women, our mortality rates for childbirth are 3 times higher than white women in America, which is a first world country. That does not make any sense. But what we do know is that there's years and years and years of divestment in our communities with our healthcare, with our education, with our food, with our neighborhoods and communities that directly impact our physical health, which goes back to the social determinants of health. So I want to also note and mention, because I've talked about depression, anxiety, and really just quickly frame what those are. Depression is a normal, it's normal. I want to be very clear with this. In your lifetime, you will experience depression 2 to 3 times in your lifetime on average. So we often think, oh, somebody has a mental health problem, that there's something's wrong with them. It's impossible to go through life as a human being and not experience depression. It just doesn't It's just always going to happen. Unfortunately, depression also has a cousin called anxiety, and they always come as a package deal, or more likely they're going to come as a package deal. And so depression is a mood disorder, and it impacts the way that we think, it impacts the way that we interact with people, can impact sleeping, it can impact your eating, it can impact weight gain, all of these other things. And it's not something that you can just pick yourself out of, because sometimes we think, well, why don't you just pick yourself up? If it were that easy, people would not lay in bed all day or not be upset or sad or crying. But I also want to do a caveat that with children and adolescents, depression looks different from what we see on TV. With children and adolescents, depression can look like extreme irritability, just really, really high risk behaviors, particularly for teens. And so I want us to pay attention to that, particularly in the Black community in the diaspora. I'm from Barbados, so West Indian massive, and I know that we tend to look at behaviors through the lens of we have to correct it. But sometimes the behaviors that you're seeing, particularly with your children, are not behaviors that they're intentionally doing. Something is going on neurologically, something is going on emotionally, and we need to get them help and support. And for adults as well, men can display depression in terms of irritability as well. Anxiety, normal that we experience to this, we have some jitters, but anxiety goes beyond the jitters. It's not something that we can control, and it's not something that we are able to fully function and have our regular daily lives. And so when you are seeing a disruption in your normal daily life and routine, a disruption in the routine and normal daily activities of your children, of your colleagues, whoever those people are that are in your circle, there may be a sign that something is going on. And I think my emphasis, particularly to Black and Brown communities, is recognizing our humanity. For so long in this country and in many parts of the world, because we see these same issues play out in New Zealand with the First People, we see this issue play out in Australia with Aboriginal tribes. This is something that we have to acknowledge our own humanity and recognizing that it is okay to not be okay. We're not supposed to be okay given the stressors and the factors that we're dealing with. Police brutality is something that this community and Black communities have been dealing with for so long. It is extremely traumatic on the brain and the physical well-being to constantly see other people under assault and yourself be under assault. Our minds and brains are definitely wired to survive, but we are on hyper alert all of the time. And that is not something that is healthy mentally, physically, socially, or in any other aspects. So what I do want us to all do before I pass this on to Dr. Pat is to recognize our own humanity and to acknowledge and be able to sit in the space and say, I'm not okay. We often think that we have to show up, and we often think that we have to do all of these things. And we sometimes rely a lot on our spirituality, which is important. But as a woman of faith, I also want to say that it is so important that we recognize that if Jesus had 12 disciples and people to help him, he's modeling for us that we need people to help us too. So I'm going to stop there and let Dr. Pat step in.
Thank you so much, Dr. Claire. Dr. Pat, last panelist, Dr. Pat Hunter Bynum, who is a trained psychoanalyst. She has worked with individuals and families of all cultures and ethnicities. Dr. Pat is going to speak to us today about another mental health issue that has really ravaged our communities from all of the disparities, and that has to do with loss and the death of our family members and loved ones, and our inability to grieve in the traditional ways that we have been known to grieve in. So, Dr. Pat, you're on.
Okay, thank you, Teresa, Dr. Rob, and Dr. Claire. This pandemic has been devastating on our community. And the grief and loss that they experience is definitely different from grief and loss of other times. They're paralyzed, they're traumatized, they're victimized, and they feel stuck. And usually, one of the theorists of grief and bereavement is Elizabeth Kubler-Ross, and she talks about 5 stages of grief. The first is denial, anger, bargaining, depression, and acceptance. However, during this pandemic, because of the social isolation and distancing, our people have not been able to grieve appropriately. And because of the long wait in having to inter or to move forward with their loved ones' funeral arrangements, they're stuck. They're stuck in anger, they're stuck in guilt. And it's overwhelming because we as a people have historical rituals. These rituals are to comfort each other during a time of death, and they're not able to do this. In the Black community and in other communities, Latin American communities, people of color, we fellowship and we get together and we bring food and we send flowers and we do monetary contributions to our grieving families. But this is not the case now. And so it is very, very hard for the mourners of this pandemic and their families to move forward. I spoke to a mortician, a local mortician recently, and she indicated that her grandfather was a mortician. And she said the wisdom that her grandfather imparted to her was that we don't have to worry about the dead because they're okay, but we have to worry about the living. And I think that our concern for the living now is, are they getting the services that they need? Are they grieving? Are they mourning? Because they cannot live in the past. And it's hard for them to move forward now because of the stay in place, the social distancing, and the restrictions which have been enforced, and rightfully so. So it's hard for our people to grieve appropriately. And hopefully, as we go into the next phase, more support and help will be given to folks so that they can grieve appropriately. And I have been working with Turning Point Counseling Ministry, doing weekly sessions on healing. And so in the next part of this discussion, I will share some of the things that we have done thus far in helping people to move forward in their grief.
Thank you, Dr. Pat. So I thank all my panelists for sharing, or at least giving us a brief overview of what's been going on and the work that they've been doing. Now what I'd like to do is to have, I'd like to have people walk away from this conference with what to do, some resources, how to do it. And so I'd like our panelists to have a conversation amongst ourselves, and I'll ask a few questions so that our attendees can have a takeaway, so to speak. So as we're talking about the issues in this syndemic, which it covers all of the areas of disparities that we've been talking about, I'd like to maybe start off with Dr. Gore. What kinds of things would you recommend as you talked about communities being at their optimal best and community resources? What kinds of things would you recommend that people in our communities do or start doing or continuing to do to at least better our overall health situations?
Excellent question, Ms. Allen. Kind of piggybacking off of some of the comments that Dr. Claire made, as well as Dr. Pat. mental health itself has always been an issue within our community. It was an issue before COVID-19. It was an issue before the protests, and it continues to be an issue. And if you are not receptive to information, I don't care how often you go to the emergency department, I don't care who you talk to, but unless you're in a position to be a willing participant, you're going to not internalize the information provided to you. So the first thing I think is really important, I'm sure our two mental health specialists on here would agree, is you have to check in with yourself. And checking in with yourself, this is something that I had to do throughout the pandemic. Some people know, some people don't know, but I've been in an Airbnb for about 10 weeks throughout the pandemic. My wife is pregnant, expecting our first child. And I'd seen so many deaths and so many friends who were infected with COVID-19 that it was definitely overwhelming. But my first priority was to ensure my family was safe. The same thing with a colleague of mine who also roomed with me in the Airbnb. He wanted to protect his family because his wife was also pregnant and needed to make sure that they were safe. There were so many deaths that we were seeing, and including our colleagues, that it really became easy to be depressed. Some of the things that helped with the depression were the fact that we didn't have a working TV in the Airbnb for the first few weeks. So you got a chance to kind of turn down some of the outside stimulation. But kind of looking at this whole concept of checking in. Checking in means making sure that you are, again, at your best. We talked about the community being at your best, but your community doesn't mean anything if you personally aren't in that state to be receptive. And checking in means, am I sleeping okay? Am I eating okay? Do I have a social support system to call on in the event that I need to vent or talk about some issues? But then taking it up another notch, it's checking in is really determining, am I functional? If I'm not functional, meaning I can't take care of myself, I'm not in a position to take care of my family because you're still processing the trauma that you've been dealing with 5, 10, 15, 20, 30, 40, 50 years prior. How do you go to work and be there and be there for your job? And as an essential worker, you have to maintain focus as a part of our jobs. If we aren't focused, that means, and if we miss some things, and I always speak about extremes because I'm in the emergency department, but you have to maintain that focus. And so if you're not checking in, if you're not even aware of your own insecurities and your own fears, are you dealing with depression? Are you dealing with anxiety? Are you having these rapid breathing episodes every time you come to work, or every time you see a truck that you're concerned that may have dead bodies on there? Are you nervous every time you hear sirens? And that's impacting your relationship at home, it's impacting your relationship at work, it's impacting your ability to do your work and take care of your family effectively. You are not at your best, which leads me to the next thing, and that's seeking out the help and counsel of a mental health specialist. There are many different many different types of mental health specialists, and I've worked with quite a number. You have your clinical social workers, your LCSWs. They're both social workers and they're trained in counseling. We have our psychologists. We have our psychiatrists, and psychiatrists are also physicians. And so if someone requires maybe a medication, they may need to seek out a psychiatrist. But usually, the first thing that I would recommend is at least seek out a counselor, psychologist, licensed clinical social worker, licensed therapist. Since we are addressing many members of the faith-based community here with this conference, many pastors and other clergy and other members of the institution have degrees in pastoral counseling. I know Rev has does a lot of work with conflict management. Many pastors and clergy are licensed to provide resources. And from the reason I bring that up is that it takes a lot of courage to seek out a mental health specialist, particularly, when you see all these fancy, initials at the end of their name. You go, oh my gosh, I must be losing my stuff. I was going to say some other bad words. So I apologize if I had to pause, but you might think you're losing your stuff. and it's an uncomfortable feeling. And because of that, because of the stigma of mental health within the African American and Afro Caribbean and African communities and other marginalized groups, we tend not to seek that stuff out. We'll pray and we'll go to church and we'll go to temple, we'll go to the masjid, but we won't do what's required to help adjust that. Seeking out members of your church who do have backgrounds may be a little bit more comforting, because you're used to talking with them, but you may not realize that they have that background. So those are some other options. Those are at least like 3 key things: checking in with yourself, making sure that you aren't, pathologic, meaning there's a condition that is detrimental to your well-being. And then last but not least, seeking out the help of a professional.
Thank you so much. And I can't stress enough, as you did, that seeking out help or checking in is a way of us not checking out. Oftentimes, many of us will speak to friends and, feel better. That's okay, but without the professional person who knows what they're listening to and how to help you, it may just be a Band-Aid. I'm going to go switch over to Dr. Claire. And as she mentioned, trauma-informed care, I want you to speak from the trauma-informed lens in terms of all of those things that happen. You started to mention anxiety and depression being first cousins. How does that show up? You did tell us a little bit about what are the signs and symptoms in our community, and when it does show up, what kinds of things should we do? Dr. Claire.
Thank you again. So I think this is a really great question. And I think Dr. Rob already talked about it, and you just mentioned some of the things as well. It does show up often in our communities, and we see that particularly in our overall health outcomes in general. So I think the first thing is recognizing that it is showing up in general and that it is already here. Sometimes we think this is some distant thing that's happening to us, but it's not. It's literally and unfortunately, mental health in our communities, it is not coincidental that we have some higher rates of schizophrenia, bipolar, major depressive disorders. Those things are very prevalent in our communities. So I think my first thing is acknowledging that it's already here. The other thing that you just mentioned as well, which I think is so important to re-stress, yes, it's important that we talk to friends and family. And I think that's so important. But I'm going to say that when someone speaks to you, we have a term that we use. We say unconditional positive regard. And there's another term that we use, which means radical belief. And those two together just mean that if somebody tells you what's happening, particularly radical belief, we just believe them. It doesn't matter how ludicrous it sounds. It doesn't matter if someone's telling you, I am seeing things, I am jittery. You know, we have a tendency to sometimes say, oh, it's not that bad. Or are you sure? Or we kind of downplay it. And what we do then is we're showing that it's not okay to talk about these things that are happening. So we have to create space to say, as ludicrous as this may sound to me, I can't imagine how terrifying this is for you. So I'm going to sit in the space of believing you. And unconditional positive regard means that regardless of who somebody is and what they're showing up with, we love them. We love on them, we accept, and we go forth with that because that's the thing that helps us to be able to think of our own well-being. If you're going to your mom, your dad, your husband, your wife, whoever, and you're saying, I feel this way, and it's dismissive, what that teaches us is that we can't say and we can't talk about it. And I want to be clear that us not addressing our mental health needs in our community is not new. It has been a survival technique. We have had to be silent for years to protect ourselves. And so this is passed on, and we pass it on whether consciously or unconsciously. If we think to slavery, and we couldn't say we're not okay, you would get shot, killed. Like, you're seeing people being raped, assaulted, all of these things, you can't say anything. So we've internalized, and it's been the way that we have survived, almost being invisible in the world. But the invisibility that we have in the world is not invisible in our bodies, and is showing up in our bodies and in our minds. And so yes, depression, anxiety, as you mentioned, as I mentioned, are first cousins, yes. And what we see particularly there is just a pervasive pattern of us not being able to be in a space that we recognize ourselves or others recognize who we are. There is a pervasive disruption in our daily routines. There's a disruption in our overall well-being, in our thinking, and how we process things. So that's all for me to couch. As I mentioned before, we have to accept and acknowledge. When we accept and acknowledge what's happening, then we have to be willing to say, I need help. And I know those are some of the hardest words to say, besides I'm sorry, and they should actually be the two phrases that we say the most as humans. But we have to be able to know it's okay to say I'm not. Just as a baby needs help to walk and talk and eat and all of those same things, we need help throughout our lifespan. So the same love, compassion, care that we give to the baby, oh my gosh, you're so cute, look at all the rolls, I'm going to help you walk. Why don't we do that to each other? Why don't we do that to ourselves? So not only do we need to acknowledge, but we need to be able to say, I need help. And then when we say we need help, tap into those networks and resources that may be able to provide some of the help and support that we need. Again, clergy, particularly in the last 2 decades, have been more and more so trained in the DSM, which is our go-to book and diagnostic and statistical manual of mental disorders. That's the way that we clinicians and those who are trained in mental health, that's the way we diagnose and assess. But just because I want to also say this particularly for Black communities, because you have a diagnosis does not mean something is wrong with you. Every single person walking on this planet has a diagnosis. I promise you. We could put somebody in any category. It is. And sometimes there's certain things like ongoing stress or just living while Black that are not in the DSM. And we know that those are real things. So just to be clear, everybody has a diagnosis. Depression is the leading cause of disability in the world. You're not alone. It's not you, it's not you. And so this part of normalizing the fact that to be human means that we have trials and tribulations in this world. We will have troubles, but take heart. There's help. And there are people who can help you. I know later on we're going to talk a little bit about some of the resources that are available, because I know one of the things I hear often is I can't find someone that looks like me, and I'm never going to say that that is not true. That's a real thing that many of us go through. However, they are resources for you, and they do exist, and I'm happy to share some of those when we get into that.
So Dr. Claire, why don't you do that right now? Share
Sure.
some of the resources. Yes.
Sure. So one of the first ones I'm going to talk about, there is an organization called Melanin and Mental Health. You can Google, all of these can be Googled. You can look that up. It's a really great resource. It combines melanated, love the color, and mental health for us. So that's one of the really great resources we can look up. Therapy for Black Girls, it's very popular, and it's a resource list. You can find the therapist, you put in your zip code, put in the area, and it's a well house of information. Consequently, there's Therapy for Black Men, which is also something that is a really, really great resource that can be helpful for you to find a therapist. Transparent Black Girl is another one. And then Transparent Black Guy is another one that you can look up. There's the National Queer and Trans Therapists of Color Network as well. If people feel not only in terms of identifying someone of color, but maybe identifying someone that is of the LGBTQ plus community to understand, that is a great resource as well. And then there's also some different podcasts that exist and things that are helpful. Black Girls Heal is one. Black Girls in OM, that's another really great resource. And Heal House, which is HEALHAUS, which is in Brooklyn, is a great wellness space. Your wellness is not just necessarily in terms of talking to a therapist. Your wellness is a holistic picture. It's every single thing. Just as we need air to breathe and we need water to drink, we need our mental health and our physical health and our social health to be well. So and physical health as in exercise as well, like getting out, walking. I know we've been isolated a lot, and inside, I say physically distant, not socially distant, because we're all together right now, and so we're connected, but we may not be physically together. Exercise, there's lots of research that shows a correlation between exercise and helping to treat depression. And so that's one of the things I think it's also important. The way we nurture our bodies and our minds is really important. And so you can just Google some of those resources, but there are a lot of resources, particularly for Black and Brown communities. And if you just Google mental health and wellness for Black and Brown communities, mental health and wellness for whatever it is, you will find.
Thank you so much for that. And Dr. Pat, unfortunately, you are dealing with the pervasive fallout of loss and people not being able to grieve the way they have been able to grieve in the past. And I'm sure that we all know that it contributes to our mental health being off center as well. So would you please finish us off for the panel talking about that experience? What can people do? I have heard from a colleague of mine many years ago that when we experience a loss, it can take anywhere from a day to a lifetime to get through it. And now with all of the other things happening, not being able to be with a loved one while they're in the hospital, not being able to visit, them subsequently dying, no closure, where are we? So can you speak to that?
Okay, thank you, Teresa. I think that one of the first things that I want to say about those folks that are mourning, and especially with the people that I'm working with, is self-care. And so frequently we ignore ourselves. And so it's important for people who are grieving and mourning to take care of themselves. And one of the ways that they can do it is by being mindful of themselves, and doing meditation and deep breathing. Self-care is crucial in folks who are dealing with trauma and loss. Also, currently I'm conducting a Zoom class with Turning Point Counseling Ministry. And this gives people an opportunity to share verbally what they're going through. They can cry, they can, express their disappointment, their anger, whatever is going on with them. They have the opportunity to do this and align themselves with other people who are experiencing the same thing. So being able to talk, because of the grief process cannot be done alone. It needs to be done collectively with others who can listen and give you, as Dr. Claire pointed out, unconditional positive regard. Don't judge me, just listen to me, okay? And so those are some of the things that we have been doing in healing our hearts. And then just what we have been doing is mailing symbolic gestures, which are like memorial candles, where people can sit and burn a candle and reflect upon the life that their loved ones have contributed and been in their life. Also, just taking care of yourself, taking the time out to be with yourself, to listen, to believe that you're going to get through this. It takes time. You might feel like you're progressing and moving forward, and then you take a step back. But that's, it's okay. It's okay. So there is no timetable, as you said, Teresa, on grief and mourning. It takes time, but it's better done when you can do it with others and they listen to you and you feel heard and accepted. Okay.
Dr. Pat, I also would like you to mention, when we were discussing how we were going to handle this panel, that resource for the elderly that.
Oh, okay. Yes.
Yes.
Okay. Yes. There. In my speaking to a local mortician, she talked about not only the magnitude of people, the numbers of people that had, died during COVID, but also the people who lived alone and did not have any information written down. And so there is a decree that the state has put out where you designate whomever you want to take care of your business and affairs if you so succumb to death. And this decree has to be notarized. It has to be filed with the state so that if anything happens to you or if you die, then your body will be disposed of in the appropriate way or the way in which you wished it to be. And the mortician that I spoke to indicated that so many people have succumbed to the COVID, living alone and not having any documentation as to how they want their end of life to be. And so she advises that anyone who lives alone have this decree and document. And I think that I have forwarded this to Dwayne so that he can share it if there's anyone interested in having a copy of it.
Thank you so much. So I know, Dr. Rob, you are on a time schedule and you do have to leave. Are there any parting words that you have before we close out? I'll give you the first chance.
Thank you again for having me. As with any restructuring of things that we do, this is a process. This is not an overnight success. Looking at improving the quality of our own mental health, physical health, and general state of well-being. Dr. Claire mentioned depression and anxiety as cousins, but also mentioned that we all experience these symptoms. Anytime you are trying to restructure something that you've been doing in a way that you've been living for a long period of time is going to take a lot of trial and error. So just remain consistent with your practice. Take notes of what's going on within your practice. Look at this as this overall systemic improvement. But if you don't understand your mistakes, if you don't see where you've come from before, and not in the sense that you just kind of have these memories that you have existing in your mental space, but really looking at a very detailed plan, then if we don't do these things are going to repeat themselves. So stay the course. There is support out there, and let's continue to engage with one another and keep this discussion going. But thank you guys again, and I look forward to, this is not the last time we'll all get together, and I think we're going to do some great work together.
Thank you so much, Dr. Gore, and the panelists as well. As Teresa joins us. Teresa, I'll let you go ahead.
Right. I just also wanted to stress that while many of us, and it's a long time tradition, that we didn't go to mental health practitioners for whatever ailed us in our families, that we did go to our church pastors or our church leaders. But many pastors are not therapists, and that they don't necessarily have the professional wherewithal and skill set to deal with the mental health problems that we present. So I do want to say that to the community at large, that speaking to your pastor is a first step. But when your pastor says you need to go see the mental health therapist, he's not saying, or she's not saying you're crazy, but that you need a different level of care. And so that's it, Dwayne. I thank you for the opportunity. Claire and Dr. Pat, is there anything else that you wanted to mention?
We do have one or two questions.
Okay, great.
I'd like to address in the last 5 minutes. Thank you to a phenomenal panel. Thank you so much for your time and imparting your expertise and experience through this traumatic time that we're still in the midst of. And it's multiple pandemics, as was mentioned, not just the health crisis, but the racial and structural inequities that we're dealing with. One of the questions that came in that was not necessarily directly addressed is, what are the trends that you're expecting on the other side of this? How will things be shifted permanently or temporarily? What are you expecting in terms of new trends on the other side of this experience that we're arguably still in the middle of?
I'm not exactly clear what you mean. So can you clarify by the other side or the trends, mental health trends?
Perhaps
social health?
telehealth, is that what you're speaking of, Dwayne?
That might be one of the things that have
Okay.
risen due to that. So yes.
Oh, got it. So yeah, we're definitely going to see, and as we are seeing, more access to telehealth. So in my capacity as the executive director for the National Association of Social Workers New York City chapter, advocacy is a lot of what we do as a membership-based organization working to advance social work. And so I've definitely been on those calls and in those meetings with the regards and writing those letters and pushing our legislators to expand telehealth. And I'm really happy to say that that's something that we've been able to do. And we're currently pushing that it's expanded beyond the pandemic. We're actually asking that it's expanded much further, because what we know is that our communities typically did not have access to mental health services. And telehealth is an amazing way. The skill sets, the empathy, the compassion, the knowledge that a therapist brings in person is the same that they can bring through the way that we're communicating right now or telephone, but it's allowed access. One of the other things we're pushing for and making sure that happens is that more people who typically were not able to receive services by people such as Ms. Allen and myself are able to do that. We're also going to see, I think, much more people hopefully focusing on the racial trauma, because the reality is that many of the experiences that we're dealing with are directly connected to racial trauma. And I would expect to see a lot more research and a lot more advocacy around addressing racial trauma as well.
Also, Claire, I'm also wondering, in your work in advocacy, what do people do if they don't have insurance? Where can they go? Where can they get attention?
Yeah, so that's definitely particularly with what's happening. So I'm going to start with, please fill out the census, please fill out the census, please fill out the census. It is so important. It determines things like your insurance, and it determines things like how many firefighters are going to be in your area to help with a fire, if to that level. So the New York State Marketplace is a great place to Google and look, and that is the insurance that our state has. New York has pretty generous insurance, Medicaid, Medicare, and those packages, so I would encourage looking at that. Thrive NYC is a really great resource as well in terms of reaching out and asking, hey, where can I go for insurance? So I would say start with those two places. Thrive NYC, you can just call and find out, hey, where can I get insurance? Or you can also Google New York State State of Health in the Marketplace, which has a lot of resources for people who are either underinsured or uninsured or not able to pay for insurance. Unfortunately, insurance is tied to employment in this country. And so we know that with the over 40 million people that have lost their jobs, many people don't have health insurance. And so I would say start at those two places, particularly if you're in New York, and look up. And if you're not in New York, because I know this is wide reaching, I would also say to Google what resources are available in the particular jurisdiction or state that you are in.
Thank you. Go ahead, Dwayne.
So the final question that came in, and it was touched on briefly as we close out, ties to eliminating the stigma that we have in our community attached to seeking out mental health support in our community. So can you share strategies of how we tear that down? I know on the call it was driven home by Dr. Ford regarding you're going to deal with depression, right? And that's eye-opening. That's great hearing it on the call. But in a macro sense, how do we address the real stigma in terms of getting mental health help?
I'd like to say a few things about that. And yes, it is a real stigma that stops us from getting not only mental health help, but medical health help. And that is this notion that we are somehow stronger than others, that we can carry it, that, you know, there are studies that speak to our high tolerance of pain. And oftentimes when we go to a medical doctor, we're not, that pain is not addressed in the same way that it would be addressed with other ethnicities. And so this thought on this belief that we got this, we can carry it, we're good. I don't need to see, you know, it's just a headache, it's just this, just a little crazy, you know, I'm just a little down. That we have to start within ourselves, believing that we deserve the help that we need. As Dr. Pat said, self-care. And are we really taking care of ourselves? So Dr. Pat and Dr. Claire, if you would like to say something on that, I would appreciate that.
Thank you. I just want to quickly say, and I'm so happy you brought that up, Ms. Allen. I would like everyone, if you have the privilege and opportunity to have Wi-Fi, and to Google TEDx talk. You can just Google it. It's called Toxic Strength, and you can go on YouTube. I really think it's necessary that we start understanding that in order to break down the stigma, we have to talk about it, and we have to acknowledge that there's nothing that makes us more human than anyone else. And while there are a lot of those studies have come out, and a lot of those have actually been used and historically to actually justify abusing Black bodies. And they needed to justify, you know, gynecology was created on slave women being tortured and tormented to build gynecology. It's what we know today in that field. It's the same thing why we were branded, because there was this inherent thought, which unfortunately is built into our medical system, that we don't feel pain the same way. And that's a lie. It's a lie. So I need us to challenge the lie. But please look up a TED Talk. It's about 13 minutes, called Toxic Strength. And it speaks to everything Ms. Allen just said.
Thank you. Dr. Pat?
No, I would agree with everything that Dr. Claire and you said. Teresa, we have to be more vigilant in getting the help that we need, and getting rid of the myth that, you know, we're strong, that we can survive and we can fight through it. You know, there is professional help out there, and so we should assess it and get it as needed.
Well said. I'd like to thank my panelists. Thank you, Dwayne. Thank you for inviting me to moderate this panel. And I believe that we certainly gave you information to help move us along in this issue of health and mental health.
Indeed, you did. And thank you again for your contribution and donating your time to advance the cause. I think it's become very clear during this time that we can't do it alone. So this type of information sharing is critically important. In the comment section of the live stream, we've gotten requests for some of the takeaways, and just want to confirm that we plan to get that out to participants. And again, thank you so much to our panelists. Your contact information is in the program, and we're excited. So I want to have the streaming community join me in a virtual hand clap. Entertaining and informative panel on very pressing issues addressing our community as we segue to the next leg of our conversation, which ties to education. So we'll give about a 2 to 3 minute break as we bring on our new panelists and introduce them, and bid adieu to our first panelist who did such a great job. Thank you so much.
Thank you.
Thank you.
Look forward to hearing from you soon.
Good.
And I said that. Did I say all that and you all didn't hear me? I need to start again? Okay. Good morning. I'm Paula Fendall. I'm board member of A Better World Community Development Corporation and an EBC member. It is my pleasure to introduce the educational panel. This panel will address the shift in the educational instruction and the move to remote learning as a result of COVID-19 pandemic. Participants will get a better understanding of the key factors and decision makers that will impact the ways that schools continue to move forward. Panelists will also provide participants useful tools to help them advocate and partner with their students, educators, and schools to work towards the best possible educational outcome in what continues to be a changing and uncertain landscape. Our educational system has been severely impacted by COVID-19, which has in turn adversely affected our youngest and most vulnerable, our children. They have experienced things that they have never seen or heard or experienced before. So we will talk about all of that in this panel. It is my pleasure to introduce Damali Smith-Tolson as the moderator of the educational panel. Damali is Director of Student Life at Baruch College, where she is responsible for developing and enhancing a supportive and nurturing environment for undergraduate and graduate students. She has over 18 years of experience. Damali has served in various capacities at Baruch, including the Assistant and Associate Directors of Student Life. And prior to her time at Baruch College, Damali worked at NYU School of Law in Student Affairs and Alumni Relations. Damali Smith-Tolson, and she will introduce the rest of her panelists.
Good morning, EBC families and friends. Welcome to our education panel. So just a thought, I love the saying, let's do a new thing. Let's, change the way that we've been living life. But it seems like 2020 has changed a lot more for us than we anticipated. And our new thing is a pandemic, a new conversation about race, and just continued upheaval in our personal and professional lives. And like Paula said, the people who are the most vulnerable are our children. And so right now, we don't even know what this educational landscape looks like. We went remote when COVID hit. Things have been in upheaval. We've seen just all the inequities in the school systems, from the type of schools to the neighborhoods, just to what the children of our essential workers have to deal with. And we don't know what this landscape is going to look like moving forward. So today we want to just take a look at what is the conversation right now? What are the key factors that are being taken into considerations as the decisions are being made? Who is making those decisions? Do the decisions vary by school? Do the decisions vary by the involvement of the parents? And then how you as a parent and a student can be an advocate and play a role to just make yourself successful in this ever-changing landscape and journey. So I'm going to introduce my panelists and ask them a question. So first we have Ashley Rougier. See, I went a little bit French on it. Ashley is an NYU alumna with an undergraduate degree in mathematics education and a graduate degree in teaching literacy B through 12. Ashley currently serves as a middle school teacher at IS 392, School for Gifted and Talented in Brooklyn, New York, where she has served as a 7th and 8th grade math teacher for the past 14 years. During this time, Ashley has served, the math team, spearheaded her school's international school-wide local trips, facilitated workshops for staff and parents ranging on topics from analyzing student data to implementing technology within the classroom to ways of differentiating within the classroom. Outside of school, Ashley has served as an educator in various capacities. Making change or even just simply being part of change is something that is important to Ashley. Hence, she bases her ideas on education and life around this one motto: movement is not going, but doing. Welcome, Ashley. And so, Ashley, just from your perspective, what has the biggest impact of going remote and COVID had on the educational system as you've seen it?
Good morning, and thank you for that wonderful introduction. In my experience, COVID-19 highlighted two major things in the education system: the inequities and the disparities within the school zones, and then the fact that we are not as 21st century ready as we really thought we were. So those are the two main highlighted issues that really have come out from March 15th, the closing of schools.
All right, thank you, Ashley. Our next panelist is Mahalia Watson. Mahalia is a Harlem-based parent advocate and founder of Let's Talk Schools, which is dedicated to producing educational events and providing resources to help parents and other stakeholders navigate the confusing maze of educational choices. As a lifelong problem solver who believes deeply in the importance of an excellent education, Mahalia could no longer stand the lack of information parents face when trying to make crucial decisions about schooling. Mahalia visits schools, writes review, and is a frequent contributor to numerous publications, including the Washington Post, New York Times, and Chalkbeat. She is also a member of the New York City High School Application Advisory Committee, a part of Fordham Law's Legal Economic Educational Advancement Project. Ms. Watson is passionate about increasing awareness of schools that serve their community well. Welcome, Mahalia. And also the same question for you. What is the biggest change you've seen since we've gone remote on the educational landscape?
Sorry, I was on mute. Thank you for having me. I think due to the measures of trying to stop the spread of COVID-19, over 1 billion students worldwide have been unable to go to school or to university at the higher level. So with the continuity of learning shifted to online, it's highlighted the inequities in learning resources. And here in the US, it's highlighted just how much schools are a safety net for many communities, areas such as food, childcare. And it's also highlighted, as Ashley said, the disparity in the available resources between the different socioeconomic groups.
Okay, thank you, Mahalia. And then last, but definitely not least, we have Tiffany Huggins. Tiffany Huggins is the Associate Director of College Counseling at Brooklyn Friends School in Brooklyn, New York. Prior to her work in college counseling, she served as the Associate Dean of Admissions at Colgate University in Hamilton, New York, and the Senior Assistant Director of Admissions at Vanderbilt University in Nashville, Tennessee. As a Posse Foundation Scholar, Tiffany attended Vanderbilt, where she developed her love for higher education. For Tiffany, college counseling extends well beyond helping students strategize to gain admission to their top schools. Counseling presents her with an opportunity to remind her students of the grace they get to give themselves throughout a daunting rite of passage. Tiffany employs a counseling model where students honor their full selves, complex identities, and maintain their integrity throughout their college search. Welcome, Tiffany. So what has been the biggest change that you've seen?
Thank you. So for me, in the world of college counseling, I've noticed this huge pivot done by the colleges, universities, high schools, and some of my families. And for many universities, they are tuition driven. And so for them, they have witnessed a downward trend in their enrollment numbers due to the international population going down with students unable to get secure visas. You have students who originally might have thought of going away for college are now looking to stay closer to home. And so for universities, they're having to strategize and quickly think of new enrollment models and for their incoming first year class. I know of my rising seniors and students who are looking to apply to college next year, this will have a long-term impact on them and their college process. But, you know, in terms of the strides that we've made in the past few decades regarding creating more equitable systems and increasing access for students of various socioeconomic backgrounds, ethnic backgrounds, global diversity, I have now noticed that there has been this widening of the gap because of COVID, due to some of the disparities are now in place. And so some families have quickly pivoted to make that adjustment and have remained in contact. So they are totally in the know. And then some families, unfortunately, have not made that quick adjustment. So we'll be interested to see what happens this fall and as well as moving forward.
Okay, thank you. So one of the things that came up in our conversation was the spring was pretty much an environment of panic. Let's do what we can and kind of normalize a completely not normal situation. Let's normalize the chaos, the grief, the change. And so families were figuring out how to teach from home, how to instruct from home, how to work from home and just kind of coexist. There are a lot of decisions that are being made and a lot of factors that are being taken into account that just a normal family would not necessarily know about. So who are actually the decision makers? Who are making the choices for what happens with our students in the fall? Is it the mayor? Is it the governor? Do individual schools play a role with this? Like, who actually is making the decision? And maybe we'll start with you, Ashley.
Sure. So all of the members that you mentioned obviously are stakeholders, and they all play a role that obviously it's a domino effect, right? But I always like to believe that the real key players are the parents. The power lies in the hands of the parents. They're the ones that really control the system. If they don't send their students to schools, teachers have no jobs. If they drop all these students off at the front door and there are no teachers there, the city is in an uproar. So at the end of the day, parents just really have to understand that their voice really does matter, and it matters all the time, not just in a crisis, that you have the power and you just have to exhibit it. So when they're sending out all of these surveys about remote learning and the re-entry plan to September, open up the surveys, be very honest and transparent in how it affected your life and how these decisions are going to affect the finances of your household and how it's going to affect the academic deficit of your students if they are not getting the quality education that a full schedule can afford them. So yes, governors, chancellors, they're putting out their suggestions, but parents, you also have a checkbox to say whether you agree or not, and you need to make sure that you're using that.
Mahalia, from a parent's perspective, what do you think is the role that you can play, or what are the factors that you're looking into in terms of education in the fall and even moving forward, period? Because like we said, COVID has exposed a lot of the disparities. So it's not just a matter of, let's just figure out, are we doing Google Meets or Zoom for the school year in the fall, but how do we address these issues long term?
Like Ashley said, as parents, we have a voice and our vote, and you know, how we affect the decisions. We can do that in a number of ways. Locally, the decisions are made by the principals, the individual schools. Parents can also join and serve on what's known as their Community Economic Council, which advises on education policies and approves zoning lines. That's the one thing that they directly approve that the the chancellor and all those other decision structures do not. Then you've got the mayor, who overall decision for the school, you know, control of the schools, and the governor, of course, as well. you know, depending on the school that you attend, the type of school that you attend, if you attend a charter school, your structure is different. If you attend, you know, Catholic schools, structure is different. Independent schools, they all have different governing structures. Those are more privately managed and as accountable to their parent body. So when we're talking about how parents can affect decisions, you know, parents in public schools, as Ashley said, have a tremendous amount of power. And, you know, decisions such as, you know, what's being taught and how it's being taught, not foregone conclusions. Parents still have a chance to weigh in and, you know, directly speak to their, whether it's through their PTA or, you know, teachers and their administration. And there's strength in numbers. I think schools sometimes tend to want to individualize issues when they come up, but if parents join together, if you're having an issue, chances are another parent's having the same issue. What you should do is use your voice and speak up, join together, and let yourself be heard, you know, so that you can actually affect change.
So one of the things that we've seen is the disparity in how resources have been allocated, primarily our technological resources. So if we are looking at a hybrid or a remote learning model for the fall, and parents have figured out, you know, the best way to work from home and kind of gotten a system together, how do you ensure that your students get the resources that are available? That they are able to advocate for the school as a whole to get the things that they need, as opposed to being reactionary. Come September, you find out you didn't get what you needed, but you see that your neighbors or someone's posting on social media about all the wonderful things that are happening in their school, and you realize that you're at a deficit. How are parents supposed to be, or even students themselves, how are they supposed to be proactive in advocating for those resources? Because we don't know what the fall is going to look like. And there are parents who will have concerns about sending their children to school for health reasons, and then there are parents who have no other option. So how do you advocate for the resources so that your child doesn't fall behind and can do the best in the environment that they're given in the fall? Any of you can start. Ashley, you have something to say
to that. Again, I know parents, it seems like a lot of pressure is being put on you, but there are moments in which most of your administrations are hosting parent meetings. Even in remote learning, they're hosting parent meetings to get input. It's very, very important that you show up for that. That is where your voice is heard. That is where you can bring to the table suggestions that you have that maybe the school committee has not even thought of, because we're looking at it from the lens of a school building and the effects there. You're looking at it from being at home and taking into consideration that gap in between what happens at home and what happens at school. So your input is very, very vital in that. And there is nothing wrong with sending an email asking, so what is the plan? Sending it to the principal, sending it to your PTA president, going to the town hall meetings and hearing the updates, and then posing those questions, starting a parent support group. Like, okay, so if we're returning back to school, does anybody live in the Bedford-Stuyvesant area? Is there a way that we can commute the kids and come up with a system? So definitely there are ways to do so, but it's all in knowing that you have the power to ask those questions. Do the schools at this moment have a plan for re-entry for September? What does it look like? Asking, is there anything that you can help with? If you're a parent that has availability that you're like, okay, I can commute some kids, or I can volunteer time, or I can support parents because I have a therapy company. Whatever it is, you just have to let that voice be heard. And just the main thing is ask questions. You have the right to do so, and you have the right for transparent answers. And if you're not getting the answers that you feel like you need, don't stop there. Find out who your liaison is for the district that you're in. Go to the superintendent, keep pushing. And like Mahalia said, it's power in numbers. So rally of the other parents that have the same concerns and push forward with it. But you definitely have the right to know what's going to happen in fall.
Tiffany, we talked a lot about the public school system and charter schools. What does this look like in private schools and Catholic schools? Is the decision making different? Do parents have the same amount of power, or, well, they're paying tuition, do they have more? Like, is there an easier way to access the information? What does that look like?
So the parents definitely have more power. Because it's so funny because there was an article, I think recently coming out of the New York Times, where they mentioned that independent schools or private schools are scrambling to figure out their enrollment. And I believe the average drop this past year in enrollment has been about 15%, which is huge going into fall 2020. And so schools across the city, independent schools have lost on average 50% of their families who would have returned in the fall. And so when schools are revenue driven, that's major, and those are jobs. And so parents certainly have a say. And when we went remote in the middle of March, it was almost as if we knew that we had to go overboard beyond to and impress our parents, let them know exactly what they're paying for, and then some. Even in my role right now, I understand that I'm technically off this summer, but because given my position, essentially I have office hours this summer, and I'm meeting with students with a big old smile, because we are committed to serving their needs. And the other thing I just wanted to add in terms of those who have a say, or in terms of advocacy, is to also empower our students. Especially in my world, I've noticed that a large number of students have been very vocal on social media regarding their needs, and they have reached out to their friends at other schools. And so there are times when they may say, I may not have a laptop or access to the internet, but my friend at Packer, somehow they were able to get that for their students. And so word spreads. And I think for students, don't shortchange your voice or your power in all of this. Yes, we have the parents, but I think that in my experience and noticing how things have reached wide masses regarding PR and publicity, students have been very vocal about what's been coming up for them and what they need in this crisis.
Thank you. So one thing that I've come across when dealing with parents is a lot of parents are intimidated by the system. I mean, any governmental system, especially I think in New York City, I might be biased, it is slightly a disaster sometimes. And so you come across resistance every step of the way. And a lot of parents may not have the educational level or the background or just the knowledge of where to start. So if you're giving advice to a parent, the one person you would ask them to reach out to, and the one question you would ask them to ask to even start the conversation. We can start with you, Mahalia, and then Ashley, and then Tiffany.
There's so many ways to come at the system, as a parent, to let your voice be heard. If I were to say the one person, I would say your teacher. You'd start with your teacher, because chances are the teacher is going to be able to make the decisions or change that directly affect your family. Now, if what you're going for is change for your child, then definitely your child's teacher is definitely the way to go. If you're looking for more of a systemic change, more of a voice in what policy is being changed, then I would definitely direct them to the CEC, which is the Community Education Council. The community, there used to be school boards back in the day, but then that was taken away. And now the mayor has this de facto board called the Panel for Educational Policy, which advises him and he makes the decision. But the CEC still has on what those decisions are that are made. Just the other day, the CEC 3 here in Upper Manhattan just voted on a resolution to have the changes to admission that affect more equity in admission. And that was very strong. CEC 2 on the Upper West Side, they have a lot of voice and a lot of power. I believe it was Alice Walker that says the most common way people give up their power is by thinking that they don't have any. As a parent, you have a lot of power. So, depending on what it is you want, if you want to advocate for your child, then I would say directly with your child's teacher might be the one way to get the most, bang for your buck. But if you're looking for systemic policy changes, then I would say your CEC is the place to start. But you shouldn't just stop there. You should let your voice be heard. The CEC, the PP, your PTA. I mean, there are many avenues that you should definitely speak up and speak out in.
Ashley?
For me, the one person would be the parent coordinator. I feel strongly that your parent coordinator should be the best friend of every parent because they are your advocate. At the end of the day, yes, they do work in the school building and they do have the best interests of the students and teachers and so forth. But their primary job is to advocate for the parents. Like, they are to be on your side at all times. So that is the person that you should have a very strong relationship with, because they are the liaison between you and the teachers, you and the administration, you and CEC. So if you don't even know who your parent coordinator is, please Google that and find out, because they are your go-to person. And they have the connections to guide you in the right direction, depending on what your concern is. That is their job, in addition to point you to the next go-to person. The main question that I feel a parent should always ask any school is, what is your ladder of referral? Oftentimes parents get pushed back because they have a concern or issue and they go straight to the top, and they've missed all 5 steps in between. And then they're not understanding, well, why am I not getting my result? Because you went over the heads of all the other people that could have assisted you, that have more knowledge about what it is your issue is, and it could have been dealt with way differently. So you always need to know, what is the ladder of referral? Is it going to the teacher first? Is it my child's direct grade guidance counselor? Is it the social worker? Is it the parent coordinator? And then where does it go from there? But going straight from, my child got a 0 for their homework, I'm calling the principal, you're missing a lot of steps in between. And as a principal, at that point, like, I can't really help you. That's not my main concern about your child's welfare, a 0 for homework. So always ask, what is it? And can I get a copy of those contact names and their phone numbers, so I know how to escalate my concerns if need be. So parent coordinator and ladder of referral.
That's amazing. I didn't know that that was the actual term for it. So thank you for that. Tiffany, how about you?
So I agree with what was shared by Mahalia and Ashley in terms of connecting with your parent coordinators and understanding like the overall hierarchy of support. I would also add is for our parents to think about your whole student. And so, yes, there are the academic concerns, but also I know at my school and several other high schools, they do have social workers or school psychologists. And so thinking about the emotional support for your kids, because sometimes that's kind of forgotten. And I think that is important for families to recognize that when their student enter these spaces, they're a whole being. And so, yes, it's important to know their advisor and the grade level dean, but when my child is experiencing anxiety or school refusal, who can I go to then? And so just thinking about the bigger picture of your student.
Okay, just to pivot the conversation a little bit in the interest of time, in our prior conversations, we talked a little bit about the day-to-day. So we now understand a little bit more about what the system looks like and even how to begin to get the information you need for how schools are moving forward. But around mid-April, a few weeks into remote learning, I saw a lot of jokes on social media about the appreciation for teachers, how parents were like, A, I don't even know who this child is. And B, I want to buy my teacher a new car. Like, can we go find a new car, a new home for my teachers? And so with this new appreciation of teachers and the roles that parents can play, what are the rights and what are the responsibilities in the day-to-day learning of your student, of the parents? Because a lot of times parents, when they do come into school, they step on toes, or, there's kind of almost a little bit of a tense relationship between the teacher-parent relationship. So Ashley, can you talk a little bit about what are the rights and responsibilities in the day-to-day educational process of your student?
Sure. So definitely, first and foremost, any online platform that your student has access to, if there is a parent membership, please make sure that you're joining. So a lot of schools use systems like Pupil Path for grading or Google Classroom. All of them have features for parents to receive alerts and notifications. So number one, make sure that you have signed up for that, because it's hard to advocate for your child's grades when they're being posted on a 24-hour basis and you're not attached to that system. So you're only seeing the grade when the report card is printed, which is 3 or 4 months in, because you weren't abreast of what was happening on your own fault, not on the fault of the school not communicating that. The other thing is finding out, what is the schedule for remote learning? Is there a schedule? If so, make sure that you're getting a copy of it. Make sure that you have it posted up. So as a parent, if you have your office space, make sure you have that posted up and you're keeping pace with that. Oh, it's 10 o'clock, they should be in ELA. Let me make sure that they're not sleeping, they're on the computer, and they're actually either working on an ELA assignment or they're actually like in conversation with the ELA teacher live at that time. Please also make sure that you're keeping them on a schedule. We as human beings, the minute that we feel like I don't have to set my alarm clock, it's human nature just to let our bodies get off of whack. And then now it's hard to regain that schedule. If your child is used to getting up at 7:30 and their first class is at 8, keep that same routine. Keep the routine of a 9 o'clock bedtime so that they're up at 7. If they normally have lunch in the school day at 12, keep that routine. Let that be the time that they shut the computer down and off, grab something to eat. So those are some things. Definitely routine is big. It's big for us as parents because it helps us navigate our schedule with students. A lot of parents are also working from home and they're on Zoom and they're on Google Meet having their own meetings. So having a family schedule makes it very easy to sort of organize where everybody in the house needs to be for quiet space, for Wi-Fi, for laptop usage, and so forth. So that would be one key thing, is making sure that you have an organized schedule, that you're aware of all of the grading policies that have been changed over time, so you know what to expect. Make sure that you're connected to all of the online platforms that your student or your child is using, so that you're getting those notifications in real time and not just shocked to 3 months later of the end results.
Thank you, Ashley. Mahalia, so you advocate for parents and you try to help them navigate the system. What does a successful partnership between the teachers and administration and the parents look like, in your opinion?
It's all the things that Ashley just said, basically. The one thing that I also wanted to stress here, while we're in this realm of online learning, is we, as parents, we should make sure that our children are engaged with their cameras on whenever possible. I mean, there may be some times where that, the situation doesn't lend itself to that, but the child should be fully engaged with the lesson that's going on with their camera on. But having a good, advocacy relationship is, being a part of your PTA whenever possible. Joining this and serving on the CEC, and talking with your child and making sure that you know what's going on, what their issues are, and if their issues are being addressed. I think one of the things that came out at the beginning of this was that it really showed that kids weren't necessarily where they were. Where they were is not where we thought they were or where we think they should have been, in school. So like really keeping in tune with your child and just letting them know what's going on. Just ask them questions. What are you doing? How are you doing? And then, a part of a group. It's really important to be a part of a group because that's how you know what's going on. That's how you know what's possible. And just having these conversations with other parents at your schools and parents at other schools, really, talking amongst yourself, and then being able to go to your teacher or your principal and really speaking up. Like, I can't stress enough how much we have to really use our voice and our vote to let our, to get out there, let our message, what we need, we have to get it out there and demand it. Don't just take, oh yeah, we're going to deal with that. We're aware of it. When you bring things up to administration, you should ask for a follow-up and an action plan and specific steps about what's going to be done, when it will be done, and follow up with that.
Okay. Tiffany, you had made a comment that actually has stuck with me for a few days, that there are some people who don't know that the game is being even played. And then there's some people who are parents and families who are playing the game well, especially with the shift in what college admissions looks like. What does playing the game well even look like?
So playing the game well first means that even acknowledging that there is a game being played. So there are times when families don't even realize that the game has already started, and how they show up will have a long-term impact on their child's success throughout high school and in my role throughout the college process. The other piece is that oftentimes when we hear this idea of the game, I just want to make the distinction that it's not always this win-lose scenario. I think oftentimes when we think of education, access, working with our families, partnering with our schools, we can be open to the possibilities of a win-win situation. And so I think that the more that schools, administrators, as well as parents and students come to the table with this understanding of how can we partner, how can we collaborate, then everyone wins in this situation. For my families, many of them, they've had to make a shift in terms of, what's happening down the road in terms of college admissions. And so they have their vision already set. And just like an athlete, if you're going into the new season, you're not thinking of training, you're thinking of the championship. And so for the families who are doing it well, they already see their child walk across the stage of their university of choice. And so I want to encourage our families to, yes, be in the present in terms of supporting your students, but also be very intentional about what is your end goal when it comes to your child's success in high school, and then backtrack. What's the plan to set them up for that success? If you want them to go to college, or maybe it's taking a gap year, well then how are we going to set a plan in place so that way they have everything they need to attain that goal? And things are shifting very quickly. And I've noticed that the parents who also do it well is that they've learned to partner with other parents, to honor their vulnerabilities, to wave their hand and say, I do not know. And there's no shame in that. And so I want to encourage families to say that you get to release ego, you get to release pride, so to speak, and embrace your vulnerability as a sign of strength and supporting your students in this game.
Okay, so let's talk a little bit about vulnerabilities. We're now in this remote learning environment. There's so many different learning styles. What do you do when, now that you've tuned in, you've created the schedule, you're realizing that the remote environment does not work for your child's learning style? Like, do you have options? Ashley, we can start with you and then go to Mahalia and Tiffany.
I mean, so the issue with the options is remote learning in and of itself isn't an option for us, right? Like, we all have to engage in it. And unfortunately, there are the disparities in just the access to the technology, the ratio of technology in a household compared to the amount of people in a household that might ordinarily one just desktop was enough because everybody was going to work and school and using electronics there. And now everybody's home and needs to be on at the same time, right? The knowledge that students have to navigate the idea of troubleshooting so many things. In school, oftentimes it's like, here's your textbook, here's a worksheet. Now we're uploading a PDF and asking them to create a text box and then fill it in and then resave it and rename it and then upload it back to Google Classroom. And these are things that a lot of us have assumptions because they are students of the 21st century, they know technology. No, they know how to upload a video to Instagram, they know how to Snapchat, but anything past that, we really haven't taught them. Like, many of us went to school, when typing came out, you had the Mavis Beacon program. You literally learned how to. And a lot of students didn't learn the how-to of these programs like Google Docs and Microsoft Word. So we're just throwing things at them and they don't really have the skill set. And unfortunately, if the parents don't, it's a lot of videos. It's a lot of Googling the how to do this. And as a parent, my main thing is, even if you can't assist with the actual troubleshooting, as Tiffany mentioned before, assist with the social emotional. A lot of our kids just get frustrated and they're like, you know what, forget it. I can't get into the Zoom. I'm not gonna log on to the classroom. I can't upload the PDF. I just won't do the assignment. And as a parent, you can still comfort them in the, okay, let's take this step by step. You know what? I don't know how to, but we can work on this together. Let's take a 5-minute break. Let's Google a video on how to do this. And I'm going to sit there and try to do it step by step with you. So those are ways in which a parent that also feels defeated, please know that there's a social emotional side that as a teacher on the other side of the screen, I can't do. And that is where you can help in a partnership of, I'm going to give the tools, but that social emotional, that when they're ready to tap out, when they've been on the computer for 4 hours, that's when you come with a plate of cookies and juice. I know you've been working hard all day. I'm proud of you. Keep going. You're almost there. June 26th is almost there. So just empowering from that stance. And unfortunately, it's a lot of having to figure out things on our own for both parents and students. And it's not an ideal fair situation, but at this point, because remote learning is not an option, it is what it is, right? So yes, as a parent, you can contact a teacher and ask, or say to them, like, I'm being very transparent in my situation. I don't have a printer, I don't have multiple modes of devices, and I have 3 kids in the household. Is there any other way that the work can get done? Can you allow for a longer deadline? Can you possibly just allow for a worksheet to, for my child just to take a picture and send it back because I don't have a scanner to do that? Is that okay? So it goes back to the relationship. And sometimes as parents, like you said, they're vulnerable and they're a little intimidated by the system, but in having that relationship, you can be transparent. I also, as a teacher, don't know what's happening in your household unless you let me in a little bit. And the more that we can have that parent-teacher relationship of transparency, you can tell me what the situation is, and then I'm able to make those accommodations. So I feel like sometimes for parents, we need to just be transparent and listen. I can or I can't do this. Like, this is out of my realm. I need assistance. As Tiffany said, raise that white flag. I need help. I need help. And do so. But if you don't, the assumption is that you're just choosing not to. And that's just me being transparent, that as the person on the other side, if you don't wave that white flag, my assumption is going to be that you just don't need the help or you don't want the help. And if that's not the case, then that's when the parent advocacy comes in, where you have to let the teacher know, no, I need it. I just don't know how or where to get it.
And just a quick question, does that include technological resources? So one of the things that's come up is some of our lower income, most of our lower income neighborhoods just don't have the technology. Like I've spoken to students who said, I signed up for an iPad because I thought it came with Wi-Fi, and then they got the iPad and they realized that it did not come with Wi-Fi service. They actually had to provide it. So are there any resources for parents who don't have the actual technology? So
So my suggestion to that, and that's why I say your parent coordinator is your best friend. A lot of different programs or grants or resources that are either provided by Department of Education or outside vendors come through the parent coordinator. Like there's some sort of notification that parent coordinators are getting, either email or a letter or something letting them know that there are events, because there are a lot of organizations that are doing pop-up events that are giving out technology and so forth. So your parent coordinator is that go-to person that will be able to tell you, listen, you live in Flatbush, next week, Saturday, this is happening at 1 o'clock. I can't guarantee you that you're going to get something, but here's an event where some resources are being given out. So that is my other thing. It's like connect to the parent coordinator and don't give up. Don't have that defeatist attitude of I don't have it, so I can't. It's the no. So how are we going to get this done? And sometimes it's schools not knowing. Like there are principals that are literally still dropping off laptops from the school building for students at their front door, but it's in them knowing. Like when that mom says, I don't have, then that principal can say, well, you know what? I'm on my way. Meet me downstairs in 10 minutes, because it's about what's beneficial to the students.
Mahalia, what are your thoughts in terms of advocating if you realize that this remote environment is not working for your student?
Definitely everything that Ashley said. And that's from a public school perspective. But if your student attends other schools, like if they attend charter school, then your reporting, who you report to is different. So in that case, you would need to go to the principal or PTA if they have one, and or the manager of the charter network, and let them know what your issues are. You just have to speak up, and you have to let people know that you need help and you want help. If it's a Catholic school, you know, same thing. You would go to your principal, because I don't believe they don't have parent coordinators in Catholic schools, and I'm pretty sure that not in charter schools either. And for independent schools, you know, you go to your administrator and let them know what you need. And you're gonna know if you speak to other parents, they're gonna let you know what they have, what can be done, and what you can ask for.
Okay, so I had an experience where I was on a Zoom with a student, and they came on camera for about 30 seconds and held up a piece of paper that said, my parents are trying to sell me. And I didn't know what that meant. We automatically had to get the authorities involved. But what do we do now that there is the blur between home life and school life and work life? How do we support those students who don't want to share what their homes look like on camera? And so you want them engaged on camera, but that also assumes a certain level of privilege that you even want people to see. I've had students Zoom me from the bathroom because that's the one place that they're okay with me seeing. How do you deal with students who don't want to share their home lives, or technology is not the issue, but where they're living is the issue, what they're eating is the issue? There are like some basic needs that are not being met right now. And so even being able to advocate and being able to deal with the things and have a schedule posted at home, those might all be luxuries. How do we support those students who don't even have that? And we'll start with you, Tiffany, and then maybe Ashley.
Wow. So I know with my school, we have been very upfront with students and honoring their experiences. And so I mean, I definitely give my school that credit, saying, yes, of course, we want you on camera. We want to see you, want to engage with you. But we also honor that everyone is not in the same space. And so for families, and I think it's perfectly fine to offer that feedback to schools and administration to say, you know, we need you all to think big picture about the full scope of what kids are experiencing. And the other piece in terms of maintaining engagement for students who may not feel comfortable showing their space, what I've done in my seminar sessions, I've told students, you can leave your camera off, but I would love for you to just chat with me, you know, so I'll turn off the chat feature for them to chat with other students. So I don't want them to be distracted, but when they have questions or I throw out a question, I would say, all your responses are just going directly to me, the host, no one else sees it. And so I think that also maintains some confidentiality for the students. And I think with my school, we had the luxury of being very flexible. And you know, there are times when I will tell students, yes, we have a classroom experience, but I would say, let's do office hours. I want to talk to you for 20 minutes. So let's set up a time just one-on-one. And if you're comfortable having your parents there, certainly. And I think for a lot of students, they feel comfortable in that setting because it can be a bit overwhelming for them to be in a space with other kids, but they feel truly comfortable just when it's just one-on-one with you and a teacher or a counselor. So I think the key is allowing that grace, sharing that out with families, and for families to be upfront about what the situation may be in terms of their current circumstances.
Ashley?
So similar to what Tiffany said, just the idea that students in public school do not have to show their face, like it is not something that I can mandate. And know that it also goes for educators as well. Like we are speaking about students that aren't comfortable in the household, but there are also educators that are not comfortable with their living circumstances. And, you know, having a union, nor do I have to show my face or my background in the screen. And I think the big thing is just having wellness checks. Just having those days where maybe it's not about the content or the assignment that's due, but it's a genuine conversation of like, how was your day? How is everything going? What are some of your fears? What are some of your concerns? Circles virtually where students just, you know, are able to get off their expressions or their feelings. Schools are safety havens for most of these students. When they know that school is up and running for them, like they know from 8 to 3, it's a place that they can get fed. It's a place that they're safe. There are adults that are watching out for them. Their friends are there. And remote learning came and disrupted all of that. You know, and we're looking at kids that might just struggle because they're only child. When you're used to going to school every single day with 200, 300, 400 people that you're interacting with, and all of a sudden now you're home all day and you're the only person there, that does play a role on your psyche. Like, who are you talking to? There's no other child there your age. So who are you engaging in dialogue or conversation with that has the same interest as you? So I think the big thing is just the wellness check. From the educator standpoint, offering opportunities for that. And then also as a parent, just maybe deciding, you know what, every Friday is going to be Family Friday. And at 5 o'clock, we're all going to sit in the living room together and just share one word about how we feel for the week. You know, and it's like, it's not about anything else. If our lights are off, we set candles, like we just make it our moment where it's like nothing else matters but just how you feel in that moment. Because at the end of the day, everybody just wants to be acknowledged. You want your feelings to be heard. You want to know that there is somebody that, even if they don't feel the same way or they don't understand your struggle, that they're willing to empathize with it. And it's about providing those opportunities in the home and outside. And like Tiffany said, using the chat feature of know that I'm here. Even if, you know, you don't want to show yourself, I'm fine, but know that we can have that dialogue. Send me an email. You know, sometimes I just post questions like, give me one word of how you're feeling, or find me a Bitmoji that describes your expression, or a meme. And then that way you can also get a sense of the kids that aren't saying it, but they'll show you a picture or a meme and you're like, this wasn't a good week. And then, you reach out to the guidance counselors and so forth and let them with their expertise go, accordingly to their ladder of referral and what needs to be done. But wellness checks are very, very important for adults and our children.
Thank you, Ashley. Mahalia, I wanted to ask you, as a parent, you're now part-time teacher, you're part-time administrator, you're a mom, and you're now the students' friends. So the lines have been blurred and the relationship with our students have shifted. So how do parents navigate that? Like, they're no longer just parents. They're playing all these different roles that they're not used to playing, and the students aren't used to seeing them in. And so now there's just like Ashley's eyebrows just shot up. There's like a whole new dynamic. How do you manage that dynamic without putting your child outside and say, come back inside when you're ready to act better? Like, how do you, because it's stressful for everyone, and they may not have the language, and you may not even have the language to kind of navigate that. So what are your tips in terms of just the change in relationship?
Wow. Just do the best you can. It's a lot of pressure. And, like you said, everybody, this is new. It's never been done before. Reach out, perhaps encourage your child to have sessions, maybe have some Zoom sessions with their classmates. I know my son, he has a group that they meet every so often, every few weeks, and they'll play video games or they'll watch a movie together. They'll watch over Netflix, and they can chat and they can just be kids and laugh and be goofy and just do all those things that they used to do when they were with each other, but now they have to do it virtually. As a parent, forgive yourself. You're not perfect, and nobody's asking you to be perfect. Just do the best you can. You have your own get together. Sometimes you can, if there's chaos going on inside the house, let it be. It's temporary. It's not going to last forever. And just remember that you need to take the time and the space for your mental health, because you need to be healthy for your kids, and just do the best you can. It's a pandemic, and if you gotta watch TV all day, then that's what you're gonna do, and it's fine. You'll survive.
Thank you, Mahalia. So we are about to wrap up, and so I want to ask the panelists, because I love to just give actionable items. I want you to give all the parents or the parent figures out there 2 assignments: one way to engage with the school or the system, and one way to engage with their students. So this is their next steps. When they sign off, not today, not tomorrow, because it's Sunday, but on Monday, this is how you suggest parents engage with the system or the school, and then with their student. So we'll start with Tiffany, and then we'll go Mahalia, and then Ashley.
So I guess I'll start first with the engage with the student, because this touched my heart. I'm a believer in being an example, and I feel as though too often we don't give ourselves grace. Now, this is our first time, to my knowledge, dealing with a pandemic. We've never had COVID-19, and yet we're all expecting things to go as normal or to get it right, and that's just not happening. And so once we acknowledge that this is brand new for everybody, and everybody's trying to find the answers, then I think that we can give ourselves grace to make mistakes and to forgive ourselves moving forward. And so for our parents, in terms of engaging with your students, I would love for my kids to just be intentional about reflection and pausing. And I think that although COVID has presented its share of challenges, I think that there's a blessing in us stopping for a moment to spend time with one another, to pick up a new skill in terms of self-reflection, in terms of spirituality. And so for parents, develop a gratitude practice, develop a spirituality practice where your students, I mean, they're watching you and they're watching how you respond to challenges and chaos. And so, they're going to take that on. So I think the more that you are forgiving yourself and you take on this level of, I'm going to pause and break and, do some self-reflection, the more your child will do that and employ in other areas of their lives. And in terms of engagement with the school, I think it is important that you, like to Ashley's point, reach out to the parent coordinator to figure out, okay, so what is, we understand that the plan for fall is still being figured out, but even in terms of the fall, like in terms of the summer, what are the plans in terms of communication with families? We know they're going to, or they should send out communication to parents regarding what is happening this fall. And so I doubt that they're going to share it out in September, but they're going to be in communication with individuals starting in July and August. And so what are some of those plans? What's a plan for communication? And I think that as long as they start with that, then I think they'll be in a good place for the fall coming up.
Thank you. Mahalia?
In terms of engaging with your kids, I would say that you guys set up some sort of routine, some sort of practice that you do as a family, whether that's daily or weekly. Just have some sort of ritual that you all do together so that you can, center yourself, understand where everyone is, just a space to have conversation and to just be yourself. I think that that's important because even though we're being remote, we can still get caught up in the everyday, I've got to go to work, I've got to go to school, I'm doing this, I'm doing that. And so I think it's very important, especially in that time together as a family. In terms of engaging with the school, I would ask that everyone, there are a couple surveys that are out right now. That one's a return to school survey. They're asking parents to weigh in on what it is you would like to see when school starts in September, if it's actually going into the school, how that's done, whether that's some sort of hybrid model or whether it's remote learning. They want to hear from parents about what they need, how they'll feel safe, and what sort of resources they'll need. So I would urge everyone to weigh in that survey, the public school, and also let your school know, whether it's through your parent coordinator or your principal, what your needs are, a family, so that you can be prepared. And I think that was it. I'm not sure if there was another.
Nope. Yeah, I think you.
And just to jump in, as we're at our 5 minutes, I know Paula had one question that came in on the front end that she wanted to pose. So Paula, there
Sure.
was.
Okay. So we've heard so much over the last couple of days about Juneteenth, although a lot of people did not know about it at all. Going forward, how, as an educator, do you plan to make sure that this information is disseminated more widely, that people really know about? How is the schools going to address it? Can you share information on that?
And just to broaden that question up a little bit more, I guess we can expand it, not just Juneteenth, but just the history of the country as it relates to racial disparities, it getting integrated into curriculum, right? Because it's not just something that one set of folks, seems to be a blanket issue. So I guess that's the.
So I would like to speak to both questions. So just to piggyback off what Mahalia was saying for the last part, I just do want to give the homework assignment, as you stated, for the parents. And this is included, that they should, a to-do, an action, create 3 letters, one to themselves, one to their child, and one to the principal of their child's school, and 4 lines. 1 line in which they identify a challenge. They are acknowledging a challenge that has occurred for either the principal, their child, or themselves. 2 lines that speak to gratitude, things that they are thankful that their child was able to work through, their principal and themselves. And then the last line, how are they going to help? So how can they help their child? How can they help the principal? And how can they help themselves during this time? So that is their homework assignment from me, Miss Ashley, the teacher. And as the teacher, my job is to educate our students about the authenticity of our history. And from the DOE lens, there is a plan to integrate curriculum that is more authentic from pre-K up. Obviously, how it gets distributed to students is going to be subjective on the level of comfort of the educator in the facts that revolve around certain historical events and their level of comfort in themselves dealing with these historical events, as well as if there is a difference between the demographics of students that they're teaching and how they themselves look. But I think we owe it, well, not I think, I know as an educator that we owe it to our students to always give them the authentic notes about their history, whether it is something that they want to face, whether it is something that they choose to acknowledge themselves, but to know that they were served the true, events of history. And especially if you are fortunate like myself, where I look like my students, and we can have a very transparent conversation that sort of showcases the difference between what happened and what the world wants you to think happens. And I think that if you are in that position, it is your obligation as that educator to make sure that you close that gap for them between what society is telling them happened and what actually did happen, and making sure that they have the tools to continue to educate themselves and not just go off of what the teacher said, what Instagram said, what the newspaper said. Dig deeper. Give them the skills on how to research so they can find out more for themselves.
Well, all right then, Ashley. Does anyone else have anything? I think we're almost at our time.
Yes, you are. But I want to thank each and every one of you. This panel was absolutely wonderful. I think there was a lot of very good information that you imparted to us. So you gave us a lot to think about, but also a lot to do as parents. Thank you.
You're welcome. Thank you.
So thank you so much for an excellent presentation panel. Thank you again, Paula, for hosting this along with the entire session. A lot of takeaways, a lot of open-ended questions, a lot of action items. So we're excited about that. But thank you. This is something that's extremely meaningful and is one of the pillars of a strong and healthy and vibrant and growing community. We have a 5-minute break prior to our next panel, which deals with business. But again, a virtual hand clap from our streaming community to this excellent panel.
Absolutely. Absolutely.
After this, but thank you so much. Thank you for your contribution to this event. Thank you for tiding your time, your community. Thank you. We're extremely grateful. Thank you so much.
Thank you for having us.
Yes, thank you.
Thank you.
Thank you.
Dwayne, are we going to the closing breakout room or we are? Okay. Maybe we're not.
Hello. Hello.
Hello.
When you consider that this president, Pierre Johnson, my predecessor just said, he can be told that if he wanted to get to a rally, he would practice his speech someplace that was safe. How surprised are you that he chose Tulsa? Given the fact that we have the Greenwood section moving 99 years, going on a century later of those horrific race annihilation there, so many 300 people dead, 8,000 people displaced. Because of the actions there.
Jocelyn seeks out ways to bring spiritual care and social equity into all her work, encouraging ideals of justice, compassion, and access.
Nicole?
Yes.
You're gonna need to start from the top. You were
I was muted.
Yeah, so it's
Okay.
perfect because it's just 12:30.
Awesome. I'm ready.
We were a little bit ahead. So I think we've got the full panel ready to go.
Awesome.
You're all
Hey, Adrian.
Okay. So I'll start again, right? My name is Nicole Monroe. I am on the Exiting Egypt Planning Committee. I've been a servant leader at Emmanuel Baptist Church for 17 years, as well as now I'm a full-time graphic designer with my own business. It is my great pleasure to introduce the business session of Exiting Egypt. We had two amazing sessions, both the mental health and wellness, as well as education. All of our speakers thus far have been amazing, and you will receive nothing less than the best from the business panel as well. This illustrious business panel will provide real-world best practices to navigate entrepreneurship and business in this current climate, both COVID-19 pandemic and the pursuit of racial equality. During the struggle of this season, it is also critical that we take a proactive approach to our business, family, and personal legacy through estate planning. Our moderator is Jocelyn Waters, our very own. She serves as a director for at Next Street, a mission-driven advisory firm promoting economic inclusivity through small business advancement. Next Street works with corporations, financial institutions, governments, and foundations to help them provide capital, customers, and technical assistance to small businesses and entrepreneurs. In 2017, Jocelyn launched a new ANEW advisory to guide individual clients toward fruitful careers and ghostwrite thought leadership pieces for executives. Jocelyn seeks out ways to bring spiritual care and social equity into all her work, encouraging ideals of justice, compassion, and access to opportunity. She has a bachelor's degree in communications and Hispanic studies from Boston College. She also serves as a servant leader at Emmanuel Baptist Church, and it is my pleasure to introduce our very own Jocelyn Waters, moderator of the business session of Exiting Egypt.
Thank you, Nicole. Thank you for that warm introduction. I appreciate it. As Nicole said, this is going to be hopefully a great session of learning, as well as opportunity for us to talk about some of the issues that we're afflicted with today and dealing with today. And I'm really excited because, as Nicole mentioned, this is an opportunity not just to talk about business, but an opportunity to focus on legacy. And so we're going to talk about the planning and preparation that it takes to build out that legacy. And also keep in mind the spiritual focus of it, that we're not hopefully just doing things for our own prosperity, but to also forward the mission of the kingdom. So I just want to start by reflecting on the fact that we recognize, as all the other sessions today have, that the pandemic, as well as the pursuit of social equity, has created a unique situation that we have not been in before. And the timing of this conference couldn't be more ideal, because as the city itself is focused on reopening, this is a great time for us as a community to really think about, do we have our ducks in a row, so to speak? And so I'm very excited about the panel we have here today. They bring such a dynamic wealth of knowledge and experience that I think is going to benefit each and every one of us. So I'm going to do a short intro of everyone, because I actually want them to introduce themselves. And so I'm just going to start with Rotimi. He has been a dynamic business owner here in the United States and here in Brooklyn specifically for some time. But the thing that I have always been moved about him is that he makes sure that he combines everything he does in his business endeavors with culture and with community, and whether that's political, social justice, or making sure that he's advancing those around him. He's made a great synergy of doing good work as well as being, a good person in his community. So Rotimi, if you would just jump in there, I would love you to share a little bit more. I'm going to also pull up what you shared with me about your businesses so that everybody can benefit from the work that you've been doing.
Thank you very much. It's great to be here. Usually I'd say ladies first, but you put me first, but ladies first always. My name is Rotimi Akinoye. I was born in Lagos, Nigeria. I am in Brooklyn. We have a few businesses. We have a retail wine shop in Bedford-Stuyvesant. It's called Bedvine Wine. We have a couple of bars and a cocktail lounge. And those are the three main businesses that we have, but we also have a company called Made in Brooklyn Summit. Made in Brooklyn Summit is trying to promote collaboration between entrepreneurs in Brooklyn, in the tech industry, in the fashion industry, and just different industries. So follow us on madeinbrooklynsummit.com. And we'll talk about other stuff later on.
Great, thank you, Rotimi. And then Elizabeth, would you mind going next?
Certainly. Thank you, Jocelyn. Thank you so much. My name's Elizabeth Grant, and I'm an attorney, and I like to say counselor at law versus an attorney, but I'm a strong advocate for proactive estate planning, which I call life and legacy planning. And I think that that needs to be purposeful, principled, and powerful. And I firmly believe that God did not give us a spirit of fear, but of sound mind, but of power, love, and a sound mind. And so we need to use that in furtherance of our legacies for future generations.
Beautiful, thank you. And Adrienne, would you go next?
Sure, my name is Adrienne Nicole. I have a video production company called Adrienne Nicole Productions, where we produce commercials and promos and interstitials and do photography, predominantly in the healthcare and multicultural spaces. So I'm incredibly passionate about ensuring that our stories as Black and Brown people are really expressed in a genuine and an authentic way. That's it.
Perfect. I love how succinct everyone is. This is great. Diana, would you round us out?
Sure. My name is Diana St. Louis, and I've taken a bit of an untraditional path. I am trained as an attorney and work as such then, but also started a lingerie business some time ago. And I'm excited to share the resources that are available for small businesses and thinking about how and when you support yourself and figure out how to create the financial health that you need in starting and maintaining a business.
Wonderful. And each of our panelists have shared with me links to their websites and their services that you will be able to access after this conversation. But just to jump right in, one of the things I've been thinking about is how trendy starting a business has become. Like being an entrepreneur is kind of the new buzzword, and what's being lost sometimes is the level of work that goes into it, especially now where we are coming out of a period of time where a lot of people have lost their jobs or maybe thinking about, I need to figure out other sources of income. What are some of the things that you would like them to consider right now as to both avoid any road bumps and also to be fruitful in their endeavors coming out of the situation that we're in? I'm going to pick on Rotimi again. Did you go first?
I'm trying to just be polite. So specific to the pandemic, I think that, I'm always a big believer in studying what other businesses are doing in your industry so that you sort of know what to do with your business. And I'm also of the mindset that a lot of the steps that needed to be taken, they should have been taken before COVID, right? You should have really been on top of your social media, on top of your website. If you have an app, to be on top of it. One of the main things of being an entrepreneur is to anticipate catastrophe and different things, right? So you're not running around when things show up. Obviously, no one could have anticipated COVID. We didn't anticipate it, but we've had a bunch of things in place so that when it did come, 2 out of 3 businesses, it really didn't affect us in a bad way. You just have to be prepared before things happen. That's the best advice I can give people.
Yeah, and I'm going to ask Diana to weigh in on this because we talked a lot about organization and specifically the work that you do at the SBA, and Next Street does similar work as far as providing technical assistance. So could you just highlight how people should be tapping into those resources so that they can be prepared the way Rotimi discussed.
Absolutely. I'll jump on and definitely co-sign and reiterate what Rotimi has said. In terms of developing a small business, you've always, whether it's a pandemic, a weather-related issue, or some wholly unanticipated family issue, preparedness is certainly part of the business plan. What happens if something goes left? And one of the things that as a community, I feel like we've certainly not taken advantage of are the resources. There are a plethora of resources out there. As Jocelyn mentioned, I work for the Small Business Administration. And one of the things I've learned in that process that I didn't know when I actually started my business were the number of local services that are available for small businesses. So I would encourage anyone who's thinking about a business, who has a business, whoever thought maybe someday they might start a business, to definitely take a look at what are called CDFIs, Community Development Financial Institutions. They are literally funded and created for the purposes of teaching, providing technical assistance. Technical assistance is basic, like, you know, how to do a business plan, how to do accounting, what legal services you should take a look at. And there are a whole bunch of them in underserved communities in particular. And again, the whole entire purpose of those institutions, those entities, is to support and assist small businesses, micro entrepreneurs they're called. So whether you want to start, like you're solo and you're going to start a cleaning business, a digital services business, a media company, whatever it is that you're going to do, tap into those services. Literally, our tax dollars go into funding and developing all kinds of opportunities for financing, for just learning how to do the business. So with that, I mean, I'm sure we'll talk about it some more later, but that's the first bit of advice I would give.
Yeah, no, and it's great, and it can't be said enough, especially right now. The other thing you'll see is corporations are literally throwing money at this because they want to be seen as good corporate citizens. So now is really a great time if you are thinking about starting out, or if you have a business and you're trying to figure out how to pivot. As a real world example, Adrian, you told me some great things about how you started your business and how you tapped into PPP. Could you provide some of that color and context through your own experience?
Sure. So, you know, I think sort of just to preface this, you know, part of having a business, you know, like Rotimi said, is to be prepared. And while we couldn't predict COVID-19, there were all of these discussions last year about an upcoming recession, right? So we didn't know this was going to be it in particular, but so I had started preparing my business for the worst for 2020. And so I actually got rid of office space and started slashing some things in my budget. But in terms of the current funding that we've been able to sort of take advantage of, is as soon as the city released funds for SBS and providing grants for small businesses, I was like number 5 in line. And so they gave out, they were covering 40% of payroll. And it was a relatively simple application, got it done, got it in, we got that grant. When PPP came around, I was number 5 in line too, but I was number 5 in line with Bank of America. And we all saw how that sort of turned out. And so we didn't get it the first round. But on the second round, we decided to go to Carver Bank instead. And we got it like that. So I think, you know, reaching out to the smaller banks really helped out. The CDFIs, I know, were really good in getting the funds to business. And it's really helped us maintain through the past 3 months, because we haven't had any shoots since March, but we have our first on Monday, thank God.
That's wonderful. And I just want to reinforce that, you know, as Diana said, the CDFIs are a great resource. New York City has a number of tools, and then corporations in your industry are looking for ways to pour into particularly Black and Brown communities right now. So if it doesn't succeed the first time, don't give up. There are plenty of options. In fact, a lot of the money that had ran out the first time is still untapped the second time. There's still money. So if capital is your issue, definitely turn back around and look at those places once again, or look at some smaller places that you may not have viewed before. On the flip side, I want to talk a little bit about, from a planning and paperwork standpoint, Elizabeth and I had a great conversation around what it means to plan. And when we talk about planning, I think that the sad reality is we lost so many important people during this pandemic, some of whom were business owners, and some of whom who had started a legacy for their families through their businesses. And I really want her to just talk about why that's so important now that we all have seen it on the big screen, so to speak, how a family can be disrupted. What should people be thinking about so they can put the right things in place early before any, whether it's tragedy at this level or any sort of disruption that might come about?
Thank you, Jocelyn. I always think of estate planning as life and legacy planning. And so in any type of plan that you might have, whether it's your business plan, you should think about, as a business owner, you should be thinking about what happens if you can't go in day after day, even if it's not death. And that's not the thing that always impacts us the most. It's really that interim during that period of time where you might be sick. And what we've seen with this pandemic is the fact that so many people, number one, we've been off for 3 months. And then secondarily, the people are not just dying straight away, they're getting sick and then they die, or they're getting sick and then they go back to life. And so what does that mean for the long term? And so we always think about estate planning as just death planning, and it's not for us, particularly as people of color. And so as people of color, we need to plan more so than other people, because what happens is that, number one, it's not just about death or taxes. We pay more than our fair share of taxes. And so we're not advocating for people not to pay their taxes as business owners, as individuals, but you want to make sure that you're not paying more than you have to pay. And so when you put a great essential plan in place, you can literally avoid those tax consequences, avoid some of those life or death decisions on your deathbed, or, so you really want to do it at a great time. But also, it gives people peace. And so when someone doesn't have to think about pulling the plug for you, or you are in the hospital and you don't know what's going to happen, you've already got a plan in place that actually speaks for you. And so whether it's your business plan, and some of the essential elements of an effective estate plan is a healthcare proxy, and that is necessarily about life. It's about who gets to speak for you when you're sick, even if it's for a day or for 3 months or 3 years. And then along with that, if you are on your deathbed, you need a living will. And so if you have a terminal condition, somebody needs to say, in the event that these are the things that she or he wanted to have in place in the event that they were going to die. And then, you could very well get better. We've seen so many people during this pandemic get better, and they leave the hospitals, even if it's after 3 months. But the question becomes, what's happened to their finances while they were in that situation? And so with the third piece of an effective estate plan is a durable power of attorney for finances. So that can pay the rent, or it can pay the bills for your employees, or keep your business running. And so I always like to think of estate planning, again, as life and legacy planning. And you also want to make sure that you have those things that bridge life and death. And so when we think of life, on the one hand, those 3 things, healthcare proxy, living will, and durable power of attorney, are critical. And then the bridges between life and death are the things like contracts. And so those contracts, your business plan decides what happens to your assets when you're sick or you die. And trusts do the same thing. And I always plan with a last will and testament. Everybody thinks I definitely need a last will and testament. And the way that we plan at Grant Counsel and Associates is that you have a last will and testament, and you don't need it, because those other things that you've done during the bridge, and this pandemic is an example of a bridge, so we're about to get into phase 2 of the bridge, but literally, those things that bridge life and death are the things that really control, not the last will and testament. But you still have a last will and testament, and you design an estate plan or a business plan or anything to not need some of those things that really prepare for the pandemic or the catastrophe, like Rotimi said.
No, and I can't stress how important this is, because whether it's property, your IP, your business itself, your home, all of these things are part of that legacy that you're building. And as a business owner, you hopefully want to pass that on to someone, or even a charity, but just you want to make sure it goes to the right place. And so I would say there are 3 things that I learned from my business experience to not skimp on, and that is the lawyer, the marketing, and the accountant. If that's not your expertise, do not feel like you need to do those things yourself. That's why the schooling to become an expert in those things takes so much time. And it's better to almost outsource those things so you can work on whatever it is your business is designed to do. So I want to circle back to something that I think is always interesting. We're going to talk a little bit more about where to get money. We're also going to talk about the social unrest and what that has meant for particularly small businesses. But before I do that, I want to hear a little bit more about some of your starting stories, like how you got started. I think that is really helpful for people to hear the turns and the pivots you had to make to get to this place so that they could maybe use that as a model for themselves. So I'm going to start with Adrian. You told me some great things about how you started your business, so I'd love for the rest of the group to hear.
Okay, so my start to opening Adrian Nicole Productions was not very sexy. I really opened the business out of a need, right? So at the time, it was 2009, and I was diagnosed with lupus. And I was like senior producer, BT, and I just figured I couldn't manage that stress as well as caring for myself and figuring out what this new life looked like. So I started a business. So it was a way for me to manage time, for me to go to the doctor, for me to really be able to manage the finances that I have to work with productions. And it worked out well, and so I kind of feel like in the beginning, I don't want to say I was like hardcore in business for the first couple of years. Like I was working and doing projects, but I didn't really visualize this really large company and, project and work that I can do really as a proper company and not really just as sort of as an individual working and producing and directing. So then after I sort of got my hands on that, I was working with nonprofits at the time because that's just where my passions were. And passion does not always equal profit, and it did not. So I needed to pivot and started working with corporations and the government. So that's where the money was. And so that's where I was able to sort of work my magic in there. And right now, we're doing work for, done work for Walmart and Ford, the city of New York, the state of New York, and things have really worked out pretty well. But in terms of, pitfalls, like you said, spend that money on those specialists. They know what they're doing. Don't try to read through a contract. It's not going to work out for you. So, I can't enforce the importance of that. I mean, very early on, I decided, hey, I'm going to pay for a lawyer. And I had a client that didn't want to pay me. But guess what? I had an ironclad contract and was able to sue them and get my money. It's like, it's afraid, you can, as a business owner, you might be afraid to do those sorts of things, but you work, you deserve to get paid. And it worked out for me. I actually got a nice little extra amount of money. And that was my trip to Paris that year. So yes, it worked out.
That's great. And you mentioned to me that one of the things that's worked out for you is the way that your business is structured. You have a lot of people that are freelance all around the country. So even though we're going through this pandemic, you have the ability to basically call on different experts as you need. And it's given you some basic stability, I guess, in how your business has been able to maintain.
Yeah. So for example, I mentioned the shoot that we have on Monday. I will not be there. It is in Ocean Township, New Jersey, which isn't very far. But because of COVID, we've had to dramatically adjust the way that we do business, and we just can't have as many people on set. So I'll be in remotely via Zoom. We were going to we're having a shoot in LA in about 3 weeks. I won't be there either. But, the crew will be there and it'll be the same situation. So just being able to, build the company so that there are opportunities that we don't miss out on just because of my locale. Adrian Nicole Productions isn't about Adrian. It's about this full organization now. And it's about really being able to prop that up. And that's how, I think all the other business owners on here can talk about. That's how you, really can increase your revenue and increase your influence and spread there. So we haven't, I'll be very honest, and frank, we have not done any shoots in the past 3 months. But in that time, we were able to provide remote opportunities and edit and do music and all of that in the meantime.
Eventually, provided we get through the other side, you now learn you can do your job from the beach.
Yes, I didn't know I could direct a shoot from the beach, and now I don't know if I'm going back.
And Rutima, you and I talked a lot about the structures you've put in place. I loved how you already had, like you mentioned, you already had your website and how you brought more inventory online. So I kind of want you to talk about both things. One, how you got started, but then two, again, the pivot that you made, even though it was slight, how it helped.
So we started in 2011. It's four Black men, my brother and a couple of other guys. We took $10,000 from our savings, each $40,000, and we opened the wine shop in a 250 square foot space. I say all of that to say a lot of times people are intimidated to start businesses and they think huge, I gotta get a loan, $200,000. And sometimes you get paralyzed if you think too big. I think it's critical that as a people that we think sort of realistically and we're open to growing. So fast forward from then, we used to work the business, the four of us. Now we have about maybe 15 employees. We've moved twice. So we went from 250 square feet to 500, and now we're at a almost 900 square feet space. We're probably going to do $2 million in sales this year. And I say all of that to say it's very important that people don't, I know some people want to open a business and they go straight to the big 2,000 square foot space, $80,000 rent. It's okay to start small. It's okay to have 4 people, $10,000 each. We didn't go to the bank. So that's how we started. And every 2 years, 2013, we opened Brew because people kept asking when you're going to open a place where we could stay in. And then 2015, we opened a Cocktail. So that is sort of how we built up to where we are now. Before COVID, we had about 50 people on payroll. All our construction, all our designs, we make it a point, easily 90% is Black workers, contractors, electrician, all of those things. So we believe in sort of economic development within the community. And then in terms of your question about, I think it was about the technology component of the business, I guess?
Yeah, you mentioned that you already sold wine online, but when COVID hit, you realized now that I have the infrastructure, let me utilize it more to maintain my relationships with my clients and keep my business thriving. So if you could talk a little bit how you've managed to maintain a thriving wine business in a pandemic, I think people would.
So we try to be ahead of the curve in a lot of the things that we do. We have a mentor, Chambers Street Wine, the owner. We sort of talked to him about moves. We started our app maybe 3 years ago, small, once again. Now we actually do, 40% of our business in terms of we ship all over the country, we deliver all over the city. And that was because we already had an app in place before COVID. What we had to do when COVID came was just to really put every picture of all our inventory on the app. Before COVID, we just had like placeholder pictures, some of them were real pictures. So we were already prepared. So now we have every single inventory we have in real time. So when we sell 20 bottles of 50 bottles, automatically it's showing 30. So when you order before COVID, people could order and then we'd be out of stuff because we weren't real time sort of removing, updating the inventory. So those are the types of things that we had to do during COVID. But technology is pretty important in any business that you're in at this point. I wish I would have invested in Zoom, but it's too late for that. But everything is really technologically based right now. So whatever business you're in, it's pretty necessary at this point to be technologically sort of up to date.
Yeah, and I won't, you don't have to go into this, but I also love how you added taste profiles, enhance the actual experience online. And these are things that are not going to go away. So even though we might be reopening, this type of customer experience is going to stay. And even though it will increase your sales as you have people walking into the store versus also people staying with the online experience. I
Yeah,
want to.
I'm sorry.
Go ahead.
Oh, I'm sorry. I'm sorry. I forgot the taste profile. It's actually critical because if you've never been in the shop, you don't know what things taste like. And in the first month of COVID, March going into April, we picked up about 300 new people on our app. That means 300 new people uploaded the app. That was not the case pre-COVID. So, so yeah, thanks for mentioning the taste profile.
Yeah. And I want to circle back to one, the money thing. Capital, everyone cares about that and cares about preparing. So I want to talk a little bit about, you said something else, Rotimi, and I know Diana has perspective on this too, is if you have to start out with a GoFundMe, that you may not be yet prepared. And I like that you talked about just getting a little bit of something together with your 4 friends so that you could start out small. So I want, if you could talk just a little bit about that. And then Diana, I would love for you to talk about how the SBA plays a role in helping people become capitally prepared and again, sustainable.
Yeah, I think that starting a business could be very intimidating, right? It's a lot of things you have to think about. This is why I could not do it by myself without a partner, so it makes sense for us. But in terms of the capital, you just have to start small. I notice now that a lot of Black businesses are starting GoFundMe before they even open. Now, it's worked for some people. I know that Krabby Shack, it worked for them. They started a GoFundMe and they're doing really well right now. But for the most part, if you have to start a GoFundMe before you open, that means you're not prepared. So you should probably not go into it in debt, basically. That's what a GoFundMe is, unless people are generously giving to you and they don't expect anything back. Some GoFundMe, you're promising them something in return. So you don't want to be in debt even before you open your business. So I would advise against GoFundMe. It's worked for some people, but I don't think it's a good way to go.
And Diana, I would love, we talked about lending versus free money, grants. I know you have great perspective on this that could be really helpful for folks.
Absolutely. I want to say my spirit leapt when Adrian talked about passion not equaling profit. I hear you, I feel you. I can almost be the poster child for every error made in starting a business, which I did. And I started with the kind of the 10, 20,000 foot level, like how hard can this be? Now I also started in a very robust economy and a lot of hubris in terms of kind of what's available and what I can do, and would never imagine. And this is pre 2009, 10, 11, where the economic world literally shifted on its axis. And then now 10 years later, then we have a pandemic. So these are all things that I hadn't contemplated when I initially started a business. I say that to say, as you're thinking about your business, like part of the planning process is considering, what does this look like when and now you also have a prototype, like this is what it looks like when it looks like it's the end of the world, and how and if I'll make it to the other side. With respect to funding, I co-sign what Rotimi says in terms of you've got to know what your constitution is. Now, one of the things I will say working with the SBA is one of the mistakes I made, I was afraid of loans. I was afraid of owing. I was afraid of a lot. And I think a lot of us are doing that for good reason, right? Because you can lose everything financially, but you can always rebuild. What I will say is starting small is a good thing, but don't be afraid of the loan. Because for instance, with the SBA and SBA loans, for instance, and they are loans for the most part, it's cash asset based. The same way when you plan your business and you figure out how much is it going to cost for inventory? How much is it going to cost for rent? How much is it going to cost to pay yourself or to pay someone else? Those are all costs that are built into the building of your business. So is a loan. Now, granted, if you're not ready, you're not going to get $1 million loan, but you might get a $10,000 one that's built into your cost infrastructure. So it's cash asset based. The presumption is, okay, am I going to sell enough X, Y, and Z, whatever, fill in the blank, to support that? So that's something to think about. So before we're like, oh no, I can't do loans, like think it through. I'm not saying go for it, and it might not work out. If the math doesn't work, it just doesn't work. So there's that. And in terms of, and Adrian pointed out in terms of the COVID situation, there is free money out there. Not a lot, let's be clear, not a lot, but there is some. So that's where I'm gonna go back to the CDFI references. Those community development financial institutions, actually have grant opportunities. And when I talk about micro, there are some programs out there that will start you off with $500. That's a free $500. So do your research. And that's the mistake I made. I just presumed that I knew way more than I actually did. And I jumped in head first thinking, again, how hard can this be? Hard. But with that said, now being part of working for the federal government in a capacity where I can use all that experience in making sure that we as a community in particular, but in general, we understand that there are a number of resources out there. And let me tell you, Google is everybody's best friend. So really, really, really take the time to really filter out and think through what are the things that I need, how can I get them met? And I promise you, there is always a resource, a how-to, a something out there that'll give you a head start. Talk to people, don't be afraid. Don't be afraid to ask questions. And sometimes people won't give you the answer that you wanna hear, and it is what it is. Sometimes people be hard, but there's always someone out there that can assist. And I absolutely, again, reinforce, take advantage of these federally funded or government funded programs. And that's the SBA, that's your local public library. That's like, you name it, just ask, look, seek, and all of that in terms of supporting your business. And that's all I got.
Yeah, and the loan forgiveness is, there is forgiveness for certain loans, so be sure to research that. And then there are a lot of corporations, again, that are starting their own grant programs. So look at your industry and who are the market leaders in your industry and see if they're running grants. I know like Shea Moisture has their community commerce program. PayPal just started some stuff. So there are plenty.
I am remiss in not mentioning the PPP. We've had conversations about this as a community church before, and a lot of people have been afraid of taking advantage of that opportunity. Don't do it to yourself. Like, that money's out there. At this point, it's like mandated law. I know there's some concerns about, well, you can't trust the government and the whats and the how's-its and that, but I promise you, if you do your research and you pay for the special services, a la get yourself a lawyer to read that contract, or make sure you're talking to a financial advisor you trust that'll walk you through what the requirements are. But literally, there are people that are getting 8 weeks to 24 weeks of their payroll managed and taken care of. And so don't pass up opportunities that are laid bare right in front of you. So yes, I was remiss in not actually mentioning the PPP up front. There's still billions of dollars on the table waiting for use. So I'm sorry to jump in there, but.
And Elizabeth, you and I talked about some of the programs that you looked at and tools that you looked at, like to get business ready. Could you share a little bit about that?
Certainly, I 100% agree with Rotimi and Diana. Literally, one of the things that, as Rotimi said, you need a mentor, you need a coach. And even though I was an accountant and a lawyer, and what Diana said, that, you know, you do think that, okay, this is my passion, this is what God has told me to do. He's telling you to still do things in order and get support, so he's constantly telling us what to do, but he's not necessarily telling us always how to do it, but we're a community. And so when we even think of ourselves as part of a community, there's a team, and we're not doing this individually by ourselves. And so what I literally, and one of my friends told me years ago, and I didn't follow her advice immediately, but she just told me to go to Weibo, because I thought, okay, I know how to start a business. But first and foremost, I didn't think of practicing law as a business. And so when you don't think of it as a business, I thought this was a skill set. I thought that this is what God had given me to do. He had got me through school and all the passing the bars and all that stuff, but I didn't think of it as a business. And when you start thinking of a business as a business, it's a lifeline. If you don't plan to have a business, you're planning to just have another job. And so if you're just sticking with, working 9 to 5 or whatever, that's a job. When you're in business for yourself, oftentimes it's, 7 to 7 or 7 to 7 the next morning. So, I've been at the office overnight, and so, we're doing everything from cleaning the office to, janitor, mail girl, every role. So you have to know all of the roles. But the thing that as an accountant, I didn't prepare myself to watch the finances. So you think, I know how to watch other people's finances. You have to watch your own. And I think Oprah said this, but I also utilize the business planning process to understand what my plan would say. I can't advise you to plan and then I don't plan over here. And so, and even planning on how you scale up. So I used WeBo, the Workshop in Business Opportunities, and I know one of our EBCers it works with WeBo, but I thought that was extremely valuable because it got me to think on that insular level, like Rotimi said. You need to think about all the details. And so it helped me figure out who my best client is, who, what things do I need to bring in? There's all of those things that I couldn't have thought about on my own. And so you need a coach, a mentor, a team. And so you want to utilize those free resources or those inexpensive resources to give you the basis of your preparedness plan. So don't just start, God still is in it and he is still advising you, but you also need the people that he puts in place for you.
Mm-hmm. I'm going to ask one more question before we go over to Q&A, but I just want to reinforce what Liz said. I'll tell you firsthand, Danaka Perry was my lawyer to get my paperwork in order. Sam Kofi in the worship team, he did my marketing, he got my brand right. So EBC has a wealth of business owners and creators in our church. And the business directory, which Dwayne mentioned, is a great resource. It's available. You can tap it right on ebcconnects.com. So utilize those resources to find the people that you need. I think there is a bit of a legal community also at EBC. So if you need a particular type of lawyer, there are many at EBC that you can tap into. So before we wrap up and go to Q&A, I just want to ask one last question around social good, and really this idea of we're in this moment in time that feels very unique. There's an opening that we see happening really around racial equity. And I think each of you have found different ways to promote that in your businesses and in your work. And I want to make sure that people that are taking part in this and listening today, if they're starting out from scratch or if they are already well into their business, that they're thinking about how do I integrate what I'm doing that's fulfilling for myself, so that it's also uplifting, empowering the community, particularly the communities of color, that where we really need to create this revolving cycle of business growth and support.
I guess I'll just go. Once again, you have to be prepared before sort of pandemics and things happen and protests. So from 2011, we've been heavily engaged in the community. I'm on several boards. I'm on the board of the Bed-Stuy YMCA, so we do a lot with them. The last year, I've been on the board of the Brooklyn Navy Yard, and I'm on the board of Eric Adams One Brooklyn. All through those organizations, we donate money. We've always been doing it. I've raised easily $20,000 for Bed-Stuy campaign against hunger, because that's just what we do. We didn't give them 20, don't get me wrong. We raised 20. And so the last 3 weeks, we've raised money for the Brooklyn NAACP because they're pushing hard against I think it's a 50B law that, 58, thank you. If you know the law, they're fighting hard for that. So we've donated money to them. We donated to the campaign against hunger. It used to be Bed-Stuy campaign against hunger. This week, we donated over $2,000 to Bed-Stuy Strong, which is just a new organization that citizens in Bed-Stuy started, and they just help local people that need food, that need money, that need business help. So we've always done it, so it's not anything new. And on a personal note, I know Rev will like this, 10%, pay your tithe. I always do it. And, I'm joking, but it's a real thing to me. I can't speak for anyone else, but that's part of giving back to the community, because I know what EBC does, so.
And Adrian, I'd love for you to weigh on this, and then we'll go to Q&A because there's some great questions I want to make sure we can tackle.
Yeah, so around the Black Lives Matter movement, it's obviously affected me and my staff and freelancers very intimately, because the majority of our staff is Black and with minority as well. But we've created content and consultation for our corporate clients who maybe don't know how to broach the subject, don't know what sort of messaging to put out there. I think we've all seen companies get it right, and then we've seen other companies get it wrong. And so we're utilizing our skill set of storytelling and really being able to identify with what's happening right now to help them really make change internally and really take into account why it's so important to pay attention to anti-racism and pay attention to the Black Lives Matter movement.
So important. And so, yeah, just make it a part of your business. Like make it a part of the mission and the vision. So it's in there on the foundational level. So we're going to use up the last bit of time to talk about some of the Q&A that we've gotten, some great questions. I'll start up with the sort of a layup. Someone asked, do you need an EIN or LLC when starting a business? Is that the first place to start?
Yes.
I'm going to jump in there and say that is an ideal way. However, it depends on the nature of your business. Because if you are super, for instance, I was chatting with a young woman, and she not quite 20 yet, and she wanted to start a business. Tried to figure out if it was nonprofit, whatever it was. And one of the things I told her, you can get an EIN number just being a solo practitioner. So there are different ways to do it. You got to figure out what your scope and your width is. I'm going to reiterate something Rotimi said in terms of growing. So you can start as a thing, as you can start solo as a solo practitioner or a sole proprietor, and then evolve and go along. But ideally, if you have the depth to do it, you should certainly figure out what your legal structure is up front. If you could be the LLC up front, but it's pricey in New York. So you got to figure out what your finances can allow. But you can definitely get an EIN number, that's free, and you should do it.
Yeah, I basically leverage Google and my lawyer, Danaka, to figure out what to do. I have both an LLC and I'm a sole proprietor for one business, and she helped me sort through the pros and cons of that. So to everyone's point on this panel, go seek out counsel, whether it's legal counsel or a mentor, and the SBA as well as SCORE. SCORE provides free, absolutely free mentorships. You can get free lawyers, free accountants. So utilize the New York City services, at least so you can get across the starting line. And then if you want to upgrade to something fancier, by all means, but they will give you free advice and free resources. Deacon Proctor asked that she said she's starting a hot sauce business and working from home, and how should she get started? She sells mainly to family and friends, but she would like to extend more locally. What steps should she take?
I am not in the hot sauce business, but she needs to get a mentor. There are just certain things, like everyone that's on this Zoom, a couple of things I need people to walk away with. First and foremost, you need a mentor. There's absolutely nothing new. Damon John is on Shark Tank, is famous for saying this. There's really nothing new that you're going to invent. There are wine shops all over the place. There are lingerie shops, lingerie businesses. I know Diana has one, shameless plug. So get a mentor. So find someone who's had a hot sauce or any kind of sauce. And I know a friend who does one, and she's in Whole Foods now. It's called Bas Bas. She's from Somali, and she's in Whole Foods. If you're interested, I can connect you to her, but you have to find a mentor who's doing what you want to do. Very simple.
Great, great answer. And someone else asked, do you have any suggestions for Black-owned tech companies, like app companies, web developers that you've used or that you want to recommend?
There's an organization called Black Women Talk Tech, I think it's called. They're on Instagram. It's a bunch of Black women in tech. Go look for them. They will have a bunch of businesses, people who are in that industry who you can work with. I think it's called Black Women Talk Tech.
And go ahead.
They were on our Made in Brooklyn Summit last event. So if you check on our IG or website, you'll probably see the information on there.
Yeah, and right now there's a campaign going on nationally called My Black Receipt. And on their website, you can actually go through their database of all, they're trying to basically make sure between Juneteenth and July 4th, that Black people are spending money with Black-owned businesses. And you can take a picture of your receipt and share it so that they can start to see how much money. I think they've only been doing it now, what, 2 days, and they're already up to like $20,000. So they have a directory on that site. And then there's a few other, and I'll share them after, a few other Black-owned directories or Black-owned company directories. And those might be a good resource as well.
There's a Black-owned Brooklyn on IG, and there's just a bunch of organizations that do that. I posted us on My Black Receipt a couple of days ago because I found out about that. But those are sort of resources that I could think about. I can't think of anyone else right now.
And who did you guys have recommendations for any of the services you used, either for your website or for your marketing or for any of the tools that you use to set your businesses up?
I'll jump in. So the New York City Small Business Services Fast Track program helped set my company up for real. So I believe it was 6 weeks or so, and it helped me set up a business plan, marketing plan, to research my competition. So, and it's totally free. And I encourage and always encourage other business owners to take advantage of it and to participate because it really helped me get started.
I'll co-sign on Fast Track. I did that as well. So we have that in common. And again, I'm going to repeat, the social media platforms are your best friend, particularly in the space that we are in now with the promotion, proliferation of Black-owned, Black business, Black investment. Like, mine the resources. There's so much out there. So really do take advantage of all of the information and resources that everyone is plugging at this point. I mean, you got to vet them because all folk are not good folk, but trust and believe there's a lot out there.
One other thing, if I can say, the city's Minority Women Business Enterprise Program, I've been part of that for at least the past 9 years. And there have been opportunities there to do work with the city through that program. But I know for sure right this moment, they are looking to do work with minorities and particularly Black companies. So that's something to take a look at.
And yeah, again, I think we should actually define this for people. So go ahead, Elizabeth.
I use WIBO, W-I-B-O, the Workshop in Business Opportunities. Sorry.
And I want to make sure that people know about MWBE. So Minority Women Business Enterprise is a national program, but it also exists locally in each state. So you can get certified in New York, and then you can also get certified federally. But at least if you get certified in New York, you can take advantage of the money that the government, they have, I think, they have a goal that says 20% of their suppliers, they want to be people of color and women, and they're not there yet. And so they have a directory on their site where you can go through all their RFPs, all the business they're trying to outsource. And you could literally start a company just being like, oh, what are they looking for? Let me start a company filling that gap. I will tell you a lot of it is construction, but there are other things that they are desperately in need of, that if you start looking through there, you could find some ideas maybe for your business, but you can also get certified so that companies who are also outsourcing work, they like to know that you're MWBE certified, not because the government requires it, but because then they can boast about being a business that supports suppliers and businesses of color and women of color and women-owned businesses. So I definitely highly recommend looking into the certification. It's free. It doesn't cost anything. It's a little bit of time and effort, but they have teams of people to help you do this. So once your business is set up, I would make that the next step to look at certification so that you have that in place.
Just on that point, really quickly, the New York Public Library actually has a plethora of workshops, information, get on their mailing list. I'm on their mailing list. They also have a competition that's in all 5 boroughs. It's called Power Up. So they give, I think, $5,000, $10,000, and $15,000. It's a business plan it's a business plan writing competition where they do train you. You have to go to a certain amount of workshops and then you compete. And that money is free. It's not a loan. It's money that you use to start your business. So New York Public Library, a lot of resources.
Great. Well, we have a few minutes left before we wrap up. I just want to see, do you have any parting thoughts for our business owners, our legacy starters that you would like them to take away? You've given us so many good things.
A couple of things, like you were alluding to earlier, if you have partners, you need a partnership agreement. You need an attorney to draw it up. You need to be specific. Maybe not, oh, Rotimi is going to be at the business 5 hours a week. Not that detailed, but detailed enough so that if there's conflict between you and your partners, you know exactly how to resolve it because it's on paper and you can review it every couple of years because as we grow, things change. The other thing I was going to mention is, and I forgot, I'll get back to it. There was something else I was thinking.
Oh, I have something to add. I know that, the constant theme is to get through something like COVID, you should have planned before, right? But that's not helpful if you didn't plan before. So, what can you do right now to sort of make it through is if you haven't already, go through every line item in your budget. If you don't have a budget, you better create one now. Go through every line, see where you can trim, cancel subscriptions that are unnecessary, downgrade to the freemiums on there. I know when COVID first hit and the feds cut the interest rate, I was on the line with my bank talking about my interest rate needs to come down on my line of credit. The Fed slashed it. What are you doing now? So they cut my interest rate. Another thing actually that I learned through this process is that if you're going to do financing, get something that is backed by the SBA. I didn't know, but I knew my line of credit was backed by the SBA, but right now, because of COVID, the government is paying my premium and interest rate for 6 months for nothing that I did. It was totally automatic. And I think you can also see that with the HUD loans for homes. So if you're going to do financing, get it backed by the SBA. It helps in times of distress.
Okay. Dan, you can go.
And co-sign on that. And again, repeat what I've been saying all along is absolutely take advantage of and I'm gonna say it one more time, CDFI, just Google it. Because those local, and the reason I go back to them is because they're local, like one might be down the street and it will redirect you to the SBA. So you'll know about the 6 months deferrals and you'll know about the extension on the maturity of a loan. So if it was a 2-year, now it's a 5-year, if it was a 10-year, now it's a 30-year. So they will work with you to figure out what can you afford right now. The idea is to keep you in business, not to like kick you out of business. Right now, the world is literally trying to prop up small businesses, and that's the general understanding. So they're all advocates for you. So please, please, please take advantage of all of these resources because that's where we're falling short. We're just literally leaving money on the table.
And I know we're running out of time, but what I was going to mention also is that, I keep going back to being prepared before things come up. So if you're going to have a business, you should know your council member in your neighborhood. You should have a relationship, not when you have a problem. You should know other business owners, any kind of bid in the area, the precinct. A lot of these things that business owners don't think about, the old saying of if you build it, they will come, they're not gonna come. You have to go out and get the business. And a lot of us open businesses and we stay in the space. You have to go out and get the business. It's too competitive out there to just kind of open and stay there.
And so I'm just going to answer a few people's questions that just came in. So just to reiterate, MWBE is Minority Women Business Enterprise. It's run through New York State and is also a federal version. I put a link together, but if you just Google NWBE certification, it will come up. And they have the directory, I think, right on their homepage. The directory tells you what opportunities the government is looking to contract someone. So they put out what's called an RFP, a request for proposal, where they're saying, we need someone to build this new school. They'll just that's what the RFP will say. You then can figure out, do I meet the qualifications? So that's that's the process that a lot of companies use, but the government certainly does. And you can search for that through the directory. They have one where they have a list that's primarily looking for minority and women-owned businesses. So they have courses on this. You can go to trainings. They have a whole team of people. So just go on their website. You'll learn more. We'll also share that as a follow-up to this so that you have that link handy. We are right at time. I really want to thank Adrienne, Elizabeth, Rotimi, and Diana for their time and their insight and wisdom. I hope this was helpful for everyone. I want to thank Emmanuel Baptist Church, the Better World Foundation. I always get this wrong. A Better World, Dwayne, Nicole, and all the folks that put this together so that we could all benefit from each other's learnings and hopefully help our own businesses and help our communities. I'll hand things back over to Dwayne and Nicole. Thank you, everyone.
Yes, I guess virtual and actual hand claps, and thank you to the panelists for sharing your information, your experiences, your expertise. All the panelists today, thank you. This is something that's critically important if we're going to move the needle and address structural issues that are present in our society. So definitely want to say thank you for the time and the investment of resources to share with those that took the time out of their schedule to participate and get some information to better their situation. And all of these topics, they're connected, right? To be a successful business person, to succeed in business, to be a successful entrepreneur, to succeed in the not-for-profit space, your mental health and wellness needs to be in top shape. It's a competitive environment. We heard that. It's difficult to succeed without mentors, right, and relationships and people helping you along. You don't want to operate in a vacuum. So that's part of the mandate for this community development conference, why we wanted to make sure that even though we couldn't commune in person, we wanted to utilize technology to present the areas of expertise that, again, our panelists have contributed to the communal pot. Want to thank Emmanuel Baptist Church for providing the platform for the Better World Community Development Corporation to expand the reach, not only in Brooklyn, not only in New York, not only in the United States, but globally. Want to thank Reverend Anthony L. Trufant, who we heard from at the beginning of this community development conference experience. Want to thank the trustees, deacons, leadership. Want to thank the board of A Better World for the work that went into putting this together. Want to thank the committee, again, headed up by Paula Fendel, committee members, Chevelle Dixon, Earl Patton, and the consultative services that we received from Nicole Monroe based on her expertise in event planning and event design. Thank you all. Chevelle Dixon, thank you so much for your work behind the scenes to get this done. We plan to have takeaways for you to leave, so look out for an email, as we have mentioned. One of the main initiatives that we have, in addition to our South Africa development projects, in addition to our Teams That Mean Business programming, is our business directory. It was alluded to during the business panel, but it's critically important that we recycle the dollars in the community to address issues of systemic racism. Even if you didn't have issues of systemic racism, it would have been critically important to have a mentor. It's even more so important for us, right? And as Diana mentioned, you want to vet this information as well because it's open broadly. But part of the follow-up, we plan to circulate the sign-up form for the Business Directory Volume 2. And that's an additional takeaway that we want you to be part of and continue the conversation, because this is only a start. And the road ahead is long. COVID is still here, racism is still here. One of the blessings and benefits is that it's being revealed and exposed, but we have real work to do and we can't do it alone. So thank you for taking the time on this beautiful Saturday morning to devote to improvement and connecting. Even though we weren't able to network, have a networking lunch as part of this experience, we hope that you were able to have a good experience and have some actionable takeaways. And we look forward to connecting with you very soon with additional information. Thank you.